the COO in 2016. And it's been a busy last 7 years, as you can see, and I'll show you. In the presentation, Mike shared some of the facilities that we've worked on over the last few years. In summary, on the screen here, you can see a few of the statistics that we've worked on. So most of you are probably new to the area, but on your way in, you passed our old sandstone clinic over here to the east, a small little building. So that's where we worked out of for a long time. A lot of history there. For about 40 years, different health entities worked on that clinic, and we outgrew it. And so in 2016, we started planning and building this clinic that we're in today. It's 52,000 square feet. At the same time, we started planning a new clinic in Blanding, a little bit smaller, but also brand new, 40,000 square feet. Moyna Valley's just got renovated last year. It's now 18,000 square feet. Navajo Mountain's gone through some renovations and additions, totaling 112,800 square feet. That doesn't include the additions of the 2 women's shelters, 2 hogans, and all the infrastructure, microwave towers. We have to build our own water tower here, and it supplies the building. So we've had a lot of hurdles to go through to get the buildings done. But almost every major site has been building now in the past 6 years. So it's been a lot of work, and we've learned a lot, and we were able to provide much better services now than any time in the past. You may have noticed that we tried to make these top of the line buildings. I remember growing up, going to dental here when I was just small, and 30 people would just sit on these little wooden chairs, looked like leftovers from the school. And the whole facility was in need of some investments, right? And so that's how I remember it. And then working here, people would come in and say, oh, that facility in Salt Lake, that was so nice. So, oh, over Durango, it's so nice. And so when we got the support of the board to build these, we wanted people to be proud of their health system. And, the design and everything, a lot of effort went into it to make it something they could be proud of. So we're hoping that you find the buildings attractive and useful. These are some pictures of the facilities. They all have very nice features. Moyna Valley view of the dental. It's the best place in the world to get a root canal. You can see out the monument there. And our staff, they're well equipped. We have top line equipment that compete with any private practice. And we make sure we try to keep them well equipped and well trained so they can do the best job they can. We recently added 3 mobile units during COVID. So one of them is dedicated to dental. One is a mobile clinic where mostly diagnosis and lab work. The third one is a digital 3D mammography mobile unit. These units have been well received throughout the community, and we're really excited to be able to offer that mobile service to people. Patients really appreciate the confidentiality and the convenience of going to a place right next to their doctor. So with these new additions, how do we know that they're improving the quality of care that we give? That's only as good as the data that you're tracking. And so our information systems team and IT teams, they work really hard at making sure we have useful data to track health outcomes. Some of the software we use are listed here. It's just a few of them, but we use Athena Health as our major EMR, our medical record. Dentrix is what we use for dental. And all the different softwares get combined into usable data using software called Tableau. Tableau is a national worldwide software company. I think they got bought out by SAP. So huge company, but what they do is if you have lots of software, how do you get it to talk to you? How do you get the information out of it? And Tableau brings them all together for usable reports that I'll show you here in a second. This is one of the first ones. This one's just about the mobile units. So it's just a sampling of what Tableau can do and what the encounters are happening for the mobile clinic, as well as the mobile mammography. You can see by location, by date, how many we're doing, and the progression of mobile clinic as well as mobile mammo. We can track things in Tableau like customer service. How long are the patients waiting for each clinic site? If you zoom in on the chart, this one, the gray area is actually a checkout process. And that is dependent on how soon the provider closes out the encounter. It doesn't necessarily mean the patient was there the whole time. Sometimes the provider waits till the end of the day to close it out. But we want to make sure that the charts are closed before the end of the day, definitely within 3 days. Otherwise, the memory of the provider of the visit kind of gets lost. So we try to make sure the accuracy of the charting is high by tracking when the charts are closed. The small blue chart, the small blue columns, that is the wait time. So you can see the actual wait time for patients to get in and be seen. This is the wait time for minutes, and you can see the breakdown. The check-in duration is dark blue, the wait for checkout, sign off, exam duration, wait exam, intake duration, and the overall check-in duration. So you can get really specific to make sure you're doing a good job. We also track our diagnosis in the EMR and do reports through Tableau. So you can see going back to 2014, we've been tracking in our EMR. Even before that, it's just this last 10 years, the number of diagnoses for each group: heart disease, substance abuse, obesity, depression, diabetes, hypertension. So some of these down here, we've seen some marginal improvements. Some continue to be on a steady population increase we've seen across populations. But we know what's happening there. This one that goes straight up, that's obesity, but that's due to us changing the way we ask the question and doing it more regularly. So that's kind of abnormality in the data. Again, mammos, tracking those when we started doing them probably in 2012, or sooner than that, 2009. And then today, we're probably going to finish the year out at our highest number ever. Certainly will be over 400 by the end of this quarter, by the end of 2023. We can track things like A1C rates for diabetics. We've seen a massive decline, a healthy decline in the number of critical A1Cs of 9+. And that's due to several programs, the nursing program, the Diabetes Control Project, working along with the providers and the pharmacies all working together. We have dietitians, we have clinical pharmacists that just do counseling for medications and assist the doctors and patients. And all that combined has led to a lot of people moving out of that critical 9+ into something closer between 6.9 and 8.9. You can see. So it's a really positive trend there for the criticals. Year-over-year encounters with increase in square footage. We've really seen a payoff in the number of patients we're able to see. You can see Blanding and Mazuma Creek trending almost together all the way up. Monument Valley is going to increase at probably our highest ever, where we still have 3 months left and we're already at 11,000. So in the last quarter, our busiest quarter of the year, it's certainly going to probably end up our busiest year ever. And mostly that's because we increased from 5 exam rooms to 18 exam rooms. So that's what we like to see when we add buildings or add on. Also, patient satisfaction. How do we know the patients are happy? We use a software to track the medical satisfaction. It's a national software that does surveys directly to the patient. So it's private. After the encounter, they're emailed or texted a response form get that information through their medical record. This is just a sample of what it can do. There's reports that come every month that are a couple hundred pages. But each site is graded, basically. They receive a grade every month on whether or not staff works together, whether or not the waiting area is pleasant, whether or not they're respected by scheduling staff, respected by nursing staff, if they felt that a visit was private, etc. So that these are tracked by location. This is a specific location of Blanding. And so you can see Blanding's meeting a lot of the metrics over the certain months. Historical number is the dark blue line, then July and then August, the last 2 months. Looks like we have to move his name, but this is a good scorecard for one provider. So providers also receive scorecards. This is happens to be a newer provider, Dane Lyman, who's received 101 patient reviews from his patients and scored very, very well. And you can see his scores there as well as his historical scores. And potentially things he probably should work on, being aware of other alternative care and medications, explaining medications. So that's not a sampling, and all of our providers would have a scorecard like that. And that's my summary. So the construction of the buildings and that turning into increased services for the patients, and not just sheer volume, but also the quality and making sure that that data is tracked. So it's been a pleasure working here the last 13 years, and hope to continue to work with the health system. Any questions?
Thank you, Mr. Clark, for the presentation. If you can email your presentation to Ms. Thompson or Ms. Spinelli, that would be helpful for us to keep the record in place. So you can email it to one of our staff and then they'll email it to us. So thank you. And then when we do have questions, we'll be at the end after the completion of all the presentations. So again, thank you, Mr. Clark. We'll go ahead and move on to the next presenter, Mr. Andrew Evans, Chief Financial Officer. And I'm assuming that that's the financial update, correct? This one here, committee members, it's this hard copy that he will be presenting on to us. Does everybody have Mr. Jensen's presentation, a copy? I believe we provided some more copies for us. Or is that for all presentations? Whenever you're ready, Mr. Evans.
Yeah, good morning. My name is Andy Evans, or Andrew. I go by that as well. If I'm in trouble or you guys need to get my attention. So,
What's your plan?
my clan. All right.
You're in trouble with
You know how to get that. Yeah. All right, well, welcome. We're really excited to have you here. I'm gonna try not to bowl you over with too many numbers here. I know when people think finances, think a lot of numbers. I'll present a few numbers here just to give you an idea of who we are, give you an idea of our scope, our size, and kind of our financial makeup. I've titled the presentation Performance, Progress, and the Future. So I want to talk about those things, kind of where we've been, over the last 4 or 5 years. So I think it was 2019 was the last time, the committee was here. So talk about, how we've done since then, some initiatives, some improvements that we've made, and then, getting ahead of ourselves, that's tomorrow night. Awesome, thank you. Appreciate that. I do have a point of clarification here. What is the official, what do you call yourself? Because I hear Hesse, I hear Hesh, I hear Hesk. What is it? Hesse, okay, all right. I'm just gonna clarify that. I hear all kinds of things, so all good things, of course, but all right, so again, we're gonna talk about our performance, some of the improvements, and then our future plans. So first off, financial performance. So this first slide, and I apologize, that's really small. So I'm a big believer in technology. I've been testing out an AI or an artificial intelligence PowerPoint program that kind of helps put together PowerPoints for you based on some inputs. This is what it gave me. It's pretty small, so I apologize, but I have on there the years 2019 through 2023 here. And then, of course, over there is the dollar amount of revenue. So you can see that over the past few years that our revenues have grown exponentially, almost doubled. So in 2019, we were at over just about 46 million, went up to about 64 million, 2020. And then in 2021, you'll notice kind of a little blip there up higher. That's because of the COVID monies that we received from HRSA and as part of the ARPA as well. So to about 73 million, back down to about 71. This year we're on track for about 76, 77. We think next year it'll be closer to about $90 million there. So I'm going to skip forward here. This one here, profit. So that's a lot of revenue. What does that really mean? At the end of the day, it's what you have left. Your expenses subtracted from your revenue there and what you can do with that. So we do believe in trying to reinvest. I'll get to that here in just a little bit, but you can see here our profit over the last 5 years. 2019, we did experience a loss of about $1.5 million. We were able to turn that around in 2020 and going forward. You can see there again that 2021 is kind of an anomaly because of COVID, back down to about 6 million this year, on track of about $7 million in net profit, and about 8 million is what we project in this upcoming fiscal period. It's a lot of money, but we do a lot of things. I went over several things that we plan on using of course, our profit for. We do reinvest the vast majority of that. And we do think that we're in a healthy financial position to be able to do some of these projects. And we do think that will be that way for several years to come. So I'm going to skip forward here to the revenue next. I apologize. I should have put this one before. So our total revenues there, about 65% of those revenues are directly from payments that we receive from providing services for our patients. So about 2/3 of our revenue. And that's actually pretty good for an MQHC and entity like ourselves. I was just at a conference up in Salt Lake City for an organization, OUCH, Association for Utah Community Health Centers, and talking with some of the other FQHCs around the state, and a lot of them don't have this kind of diversity of revenue mix. Not to say that they're not doing things correctly, they don't have that benefit. Sometimes 80–90% of the revenue comes from grants, or 90% of the revenue sometimes even comes just from one grant. And so we're fortunate to be in a position to where we have diversification of revenue, and 2/3 of our revenue comes just from seeing our patients. About 20% of our revenue comes directly from contracts. We do have a contract as a 638. Of course, you probably know this. with IHS, so we negotiate directly with IHS for contract support costs to help us to support us in providing services for IHS eligible patients. About 13% of our revenue comes from grants. We'll talk a little bit more about that here. And about 2% is other revenue that comes from, our market, comes from some investments that we have. I'll go back to the previous one here. That's 65% of revenue that comes from providing services for patients. This is the makeup of that, or the mix of that. So about 2/3 of that comes from Medicaid. Most of that in the state of Utah, and then of course the state of Arizona. We do see patients in New Mexico, Colorado, rarely outside of that, but we do see that sometimes. But most of that is Utah and Arizona Medicaid. About 28% of our patient service revenue comes from private commercial. That's actually been increasing, which is a good thing. Over the past few years, our eligibility specialists have really been working hard with community members to help them become eligible for, or to help them to enroll in private insurance in the marketplace. They've also been trying to help them enroll in Medicaid and Medicare as well, if they're eligible. Medicare makes up about 6%, and then self-pays about 2%. So those that don't have insurance. I will point out that about 1/3 of our patients are IHS eligible, but of course we don't, record that as revenue. We write that off each year. But if that were to be on there, it'd be about 33%. Okay, now that we've given you a kind of glimpse into what we've done over the last 5 years financially, I want to talk about some of the improvement initiatives that we successfully implemented over the past couple of years. These are just a few, and again, they're kind of finance oriented, so this doesn't encompass everything. But it's, I talked about technology. We are big believers in technology. So we have taken a good portion of that profit and invested that in real-time reporting and financial management systems. I think Byron went over a couple of those medical record systems for where we hold our patient data. Mike talked also about our data management team. So we've really implemented technology to help improve accuracy and the timeliness of our financial information. And so our financial predecessors did a really good job of getting us to where we're at, but I feel like we've done a really good job over the last 4 or 5 years of focusing on real-time data, real-time reporting, rather than waiting a month, 3 months, even sometimes a year to get financial information. And by that time, of course, it's a little bit stale. So I've listed some programs in there. I won't go through those, but those are all cloud-based programs that we use that are fully integrated into our financial system, that employees use, that we use, that really kind of helps our internal management make real-time decisions, and they're able to pull up reports, see where they are at any given moment. We've also implemented a revenue cycle steering committee. So we launched a committee resulting in increased financial transparency and compliance. And we meet monthly with providers, different department leaders, our data analytics team, the finance team, and we really talk about the revenue cycle all the way from the beginning, patient registration, everything in between, and to the end, billing and collecting payment for patient services. This has really helped clarify internally with providers, what kind of documentation support we need, make sure we're doing things correctly, make sure we're billing the way that we're supposed to. It's helped quite a bit. Of course, we've increased funding opportunities and we've expanded our network of potential funding sources. So we've strengthened and formed new key partnerships with Navajo Nation, with the state of Utah, just recently with the state of New Mexico. I think you'll hear about that. And then, of course, with local delegates, and we're really have been thankful for that. Navajo Nation, the Department of Social Services there, Mr. Cody, others have really helped us quite a bit, especially with the shelters recently, and to find additional sources of funding. And so we hope to be able to continue to do that with them as well. And several of the local delegates have been instrumental as well and really know and understand what our community needs are. It's been very helpful. And of course, data analysis, we talked about that. So we worked with our internal data management team to help identify opportunities for improvement. All right, so our future financial plans. So I put 3 kind of points here. Of course, it's larger than that, but here are 3 things that we're really focused on. One of those, of course, is diversifying funding opportunities. I put on there grant writing. So we have 1 full-time grant writer, but we feel that this is an opportunity for us to really grow. And so we're going to establish a grant writing team to help us expand that. We've had some kind of quasi grant writers in the ones right here in our behavioral health department and a couple other departments who have really stepped up and helped. It's not really their role for the organization, but we've realized from what they've been able to accomplish, what they've been able to do, that this is something that we should be more focused on. Researching potential funding opportunities based on community and patient needs. And then, of course, as I mentioned, fostering and strengthening relationships with local leaders, also with the state, with different potential funding grantors and contractors. Another item of focus for the future would be investment in UNHS and the community. We want to continue to provide the services that we're already providing, but we want to expand those services. Byron talked a little bit about that. We want to continue to be able to do that, to expand our clinics, to be able to provide additional services. Mike talked about the community projects. We want to invest in the community, even outside of the clinic space. We talked about the grocery store, talked about housing and other projects there. And of course, we want to invest in our employees. We want to invest in their wellness, and we already provide, we think, very generous benefits. We want to be able to continue that and even provide more benefits for our employees to make sure that their financial well-being is a priority for us, that things are going well for them outside of the clinic, as well as whether you're at work. And then finally, we want to continue to be financially transparent. And we want to be responsible with the funds that are in our custody. We want to be proactive versus reactive with our decisions. We talked about the data, we talked about technology, we talked about trying to meet the needs of the community. And so we hope to get ahead of the curve on some of the issues that we're dealing with and be proactive rather than reactive. And then, of course, communicate with internal and external members, which is what we're doing here right now. So we want to continue to improve in that area as well. And that is all that I have. So appreciate your time. Thank you. And I'd be happy to answer any questions when the time comes.
Thank you very much, Mr. Evans, for that presentation. And just an FYI, when you have multiple strands of necklace, you give 1 strand each to a delegate. Okay, moving on. Okay, moving on to the next presenter. Thank you. Again, that would be Herb Paul Jr. And Patera Martinez, which would be the Chief Human Resource Officer, Mr. Paul Jr. And I believe Ms. Martinez is going to provide the presentation? Okay.
Chair, if you could, not put the, her child just lost her mom, so she's busy with that, for something to do with that. Here, she's working with her child. On the days of issuing each presented on it, but which in how it's the mail, not on the other people.
Okay. Thank you, for that clarification. For the record, I'd like to make it known, that, from information based off the board chair, Mr. Jones, that, Mr. Herb, Jr. Is, busy with, managing the loss of his mother. So with that, we will move on to, the co-individual, which is, Katera Martinez, to provide the presentation regarding human resource, committee members and for the record. So Ms. Martinez, the floor is yours.
Okay, Chair Katera Martinez here, Chair. Could you treat me initially the polling questions to me? Could you treat me Dr. Chair? I live in Red Mesa. I've been in the human, I've been with UNHS for about 13 years total. Eight of those years have been in human resource. I worked with Herb for the last 7 years. And he really wanted to be here today, but you know, with he's dealing with a lot at home, so I'm filling in for him. And yeah, and then at the end, if you have any questions, I'll let you guys ask those questions. So at the start of my time here at UNHS, we've only had 90 employees total, with 4 main sites, and since then we've really grown a lot, and I'll show you some of the data. So here in Montezuma Creek, we've been here, we like to call ourselves the headquarters just because our executive team, their offices are here, and a lot of our finance and accounts receivable locations. And then our next biggest site is Blanding Family Practice in Blanding, Utah. Next is Monument Valley Healthcare in Monument Valley, then Navajo Mountain, which is our furthest site. It takes about 6 hours round trip to get there and come back, and then San Juan Family Dental in Monticello, Gentle Iron Hawk Shelter in Blanding, and then in May, we acquired Northern Tree in Shiprock. And then we also have DV Advocate offices in Crown Point and Gallup area. Yeah, so just a couple of facts for the and just to go back before, so how we try to keep our facilities together and on the same page, we do have weekly meetings with all of the department leaders. We do have 1 monthly meeting in person where we tell everybody, updates and things that are coming up. And so we try to keep all of our locations together and see. And I think we've done a pretty good job of doing that. And then the next thing is, so at the beginning of our fiscal year, which starts on October 1st, we've hired about 91 employees, which is how much employees we started with way back in 2013. And out of those 91 employees, 5 of them are starting today. There we have new employee orientation for 2 days. But yeah, 91 employees started since October 1st, which is almost a year ago. 37 employees have termed. And like the top 3 reasons why employees have left is relocation, childcare, and going back to school. So which brings our turnover rate to 7.9%. And the average employee that's been with UNHS is 6.2 years. And we do have employees that have been with us since 2000. We have about like 7 employees so they're coming up to their 24th year with us, and we're really excited, and they love it here. We always I always ask them, like, what do you like, like your time from when you started here to now, and they can just go on and on, but we really enjoy, all of our employees and they do like working. Our majority, of our workforce are female, so 76%, and then 24% of male employees. And UNHS follows the Navajo's Preference Employment Act. So out of 491 employees, 365 identify themselves as Finnish, 7 identify as Hispanic, 109 identify as white, and 6 identify as 2 or more races. Like I mentioned, we do have new hire orientation every 2 weeks. And so for 2 days, we'll keep them from, Monday and Tuesday. We'll try to make them as comfortable as possible. We provide lunch for them. And if they are traveling from far, we do provide hotel stay until they're done with orientation here. Part of our orientation process is we go through our company history. We go through a little bit of Navajo history, because we do have some non-natives that come and are a part of the new hire orientation. We do a facility tour. We have presentations from different staff members, policies and procedures we'll go through thoroughly. And then we also have mandatory training that consists of HIPAA, safety, security, transportation, bloodborne pathogens, sexual harassment, bullying in the workplace, child abuse, and elder abuse. And when we offer our employees to come and work for us, for the full-time benefits, it's very rich. It's kind of amazing when people come and they're like, wow, you guys have such great benefits, and we pride ourselves in that because we really try to take care of our employees and their family too, because if an employee is worried about their family, they're not going to do a really good job in their job here at UNHS. And so, we offer medical insurance 100% paid for in network and out of network. And so I work with benefits as well. So I know a lot about the medical insurance, and we went through a whole process recently, and even our brokers, off reservation, they're like, you have a really good, insurance. And the next one is life insurance that starts at $50,000 that UNHS covers for the employee, and then any voluntary coverages for the is optional for the employee. Dental insurance is optional, but they're really good rates. We also offer short-term, long-term disability, accident, critical illness, hospital. We have 12 paid holidays throughout the year. We have PTO and vacation accrual from when you start the first time during payday, you start accruing PTO and vacation. We also have an employee recognition program. So anybody who goes above and beyond, they get points, and they can redeem it for cash or items like, house supplies or wellness material. And I'll go in a little bit more about our wellness program, which is something I've never had before, working with other companies. And so we've really grown our wellness program in the last 5 years. So our employee wellness specialist, her name is Kathleen Whitmore. She's been with us for almost 2 years now. And she works closely with their other programs, which is the diabetes care program, High 365. And she's the one that, kind of coordinates all of our employee wellness activities, not just physical, but, well-being and mental. So she coordinates all those programs and works closely with our radiology department. On here, it says all employees, regardless if they're part-time, full-time, as needed, they can participate in our Go 365 wellness program, our employee recognition program, And then we do have fitness rooms at Harmonism Creek Landing Family Practice and Monument Valley locations. We also have our AUP program, which if any employee needs kind of counseling sessions, or if they feel like they need to talk to somebody, then we have that our Jorgensen and Brooks that they can call at any time. And then our full-time employees, they get all the above, and also our we also get to participate in our traditional practitioner benefits, which so what happens is if they go and get traditional counseling, then you can get reimbursed for those ceremonies. We have our weight loss program, and then our Livongo, which is part of our diabetes program. So a couple of examples of worksite activities that we do is we do a lot of virtual 5K and community 5K. We have nutrition, what's called Taste and Learn, which happens monthly. They'll come into here actually, and they'll do a food demonstration of healthy eating, foods that you can substitute. And if you're not able to come in person, then you can participate by Googling. Another awareness we have, so this coming October, we have breast cancer awareness, sexual assault awareness, Native American Heritage Month, Heart Healthy Month, Domestic Violence Awareness Month. And they do a lot of different activities throughout those months, not just for employees, but it also goes into the community that the community can participate as well. And then we also do Earth Day, where we have a community cleanup at most of our sites. And then the administration team was so kind to give us healthy snacks on Thursdays. So they'll provide like a pick-me-up for all the sites where they can go and get snacks at 2 o'clock when we're feeling a little sluggish. And then Ernest Begay also he just completed his weekly NACO cultural presentation. So every Thursday he goes over during lunch a different topic, and they're very interesting and they're very informal. I hope he starts that again. Because in the new year. New year? Oh, okay, great. He's gonna start that up again in the new year. But yeah, for about 45 minutes, he'll just go over something different. And so they're very interesting, and I enjoy participating. And then now we're doing our financial workshop with IDP and finance. So Andy Evans, he goes over at 3 o'clock weekly over a different topic in finance. There might be something about savings, or something about your credit score. So those are very interesting. And then we have our Medline training, and then we also have our Halloween activities that are coming up for Halloween. So I don't know if you guys have enough time to watch this YouTube video. I heard my supervisor wanted me to play it. So I don't know, do you guys have time, or it's about 7 minutes? If not, we could just, okay.
Not too sure.
Okay. Here at Utah Mental Health System, our mission statement is we exist to improve your quality of life through comprehensive, self-empowered, culturally sensitive, and engaging service.
What I like about working for UHS facilities, number one, the clinical pharmacy program is really pushing the limits of like clinical student. Reduce my days in the clinic seeing patients on a regular basis, on diabetes patients or diabetes programs, focus specifically on that disease state we can do and even like those patients we can spend a little more time with them what we're doing. And we also oversee anti-hypertension clinic as well as other hypertension and some other disease states that we can on.
Even though we are a rural area, we try to bring the best quality care that we can to the patients in our area.
I do feel like I make a difference with these people, and it might not be a huge difference right off the bat. But I think understanding their social issues and their problems and incorporating that into the care you give them makes a huge difference. I think in the city, it's a completely different set of issues and the difference you can make.
I believe that the administrative team has created healthy environments. They have a good policy. They support educational goals, but they do also encourage us to do our best in jobs that we need here.
The company has been really supportive of any employee who wanted to advance. So if they wanted to go back to school, get more training, particularly in the medical side. So the MBA wanted to go to nursing school, and the nurse wanted to go to PA school, anything like that, they have a really good tuition reimbursement program, which several employees have taken advantage of, and several of our PAs that have come back and are now working for us. So they really, really support the employee and what they're doing.
I believe that the work environment here is very positive. All of our employees are very willing to help our patients and giving good quality customer service. Patients are our number one priority, and making them feel like they're getting the best quality care that they can.
And patient, one of the big flaws here is the fact that what we're doing here is having such a big benefit to our patient population. We're seeing new people come in all the time and being able to make substantial changes that ultimately make long lasting big improvements to their health and their family's health as they go along.
We're here because of the environment. It's great as far as the people that we work with, the friendly environment, the helpful environment, as well as it's just a wonderful, safe, clean building. You walk in this building and you just feel healthy. I remember when we had the original clinic when I started here, and it was like small and crowded and dark and the ceilings were low. And this company has been great to keep up with improvements as far as, you know, the working conditions, but not only that, I just better wellness of the patients and just making it a healthy environment. So one of our benefits here at Utah Navajo Health System is our wellness program. We encourage our employees to live a healthy lifestyle. We have classes at lunch with our instructor. Fitness center also helps with living that healthy lifestyle. A lot of our employees, they exercise at lunch. They'll run 3 miles in the mesas, or they'll go to our gym here in the building.
I like being outdoors, and before I lived like the center of everything, you have Moab, you have Colorado, you have New Mexico, you have Arizona. And I've been mostly everywhere within the Four Corners area, and they also have a lot of great events. I run into half marathon races, or sometimes they have some trail runs here. We have a lot of ultra runs too around the Four Corners. I ride horses, I like running, there's world-class hiking, biking. You can do anything here. I love working here. I love the new friends that I've made. I ran an operating room before this. And so coming down here is just like a really good refresher for me.
I enjoy hunting, fishing, and we probably have some of the greatest opportunities in the world with that. I live in Landing. I'm only 90 minutes from the town. Being on water fishing, we spend a lot of time in the mountain. You could either go hit the desert, you can be down on the desert in no time, or you can be in the 1,008 for 40 minutes and enjoying the thin air and life is lots of opportunities to be on this kind of the country world around it's sites and not hiking opportunities or there's more than those opportunities.
Small community out here, like Marine Valley or Madison Creek, you know, you get to know everybody. First hand, first name, basic and stuff like that. So, you know, I would say that, you know, you got to be more relaxed. You get to know people, you get to know your patient, client.
I like the people a lot. The culture is really fun, and Navajo people are just funny in general. And they're just good people. I mean, I like the environment atmosphere, and our patients are good.
I have a young family. The communities here are great for raising kids. You don't have all the reasons. You only have another locations and you get to get out and teach kids how to work and have fun. Lots of good friends and opportunities for them to do the things that I did, which I appreciate.
We provide great opportunities at all our facilities with open arms and amazing customer service to our patients. That's what it is here. It's you're getting out and you're moving. And you're moving and you're breathing the fresh air and you're seeing how dark the sky gets at night. I don't think there's any better place to come home to.
You like taking care of the patients and like giving 100% of what you do every day and enjoying what you do. This is a place that has your back. They're going to push you to excel and give you every opportunity that you have. You find satisfaction in your job, you find satisfaction in your days off, you find satisfaction in your family life. We make a true difference to our patients and our communities here with what we do.
Then I switched to Liberty Mutual and they had I know.
Great. So I'd just like to end with our mission statement, our vision and our value statement. So we exist to improve quality of life through comprehensive, self-empowered, culturally sensitive healthcare and amazing customer service. Our vision is UNICHES will develop and expand healthcare service and community partnerships while improving economic opportunities for all communities. Our values is unit justice, customer focused, responsive, respectful, honest, and committed to excellence through teamwork in delivering healthcare. And based off all of our presentations from Byron and Mike and Andy, I think we're doing a good job at our statement, our mission, our vision, and our value statements. That's it. Do you guys have any questions?
Thank you very much, Ms. Martinez, in regards to human resource, presentation. With that, we will move on to the next, presenter, Dr. Al Val Jones.
Okay, instead of the medical staff, we're gonna have a report from the behavioral health. It's gonna be Rachel and discuss Sandra, so the substitution, behavioral health instead of the medical.
Rachel Holiday. Okay, so with that, Rachel Holiday,
And Calandra Holly.
oh, Alandra. Alandra Holiday, Holiday. Okay. So with that, Rachel Holiday and Cassandra Holly.
And
Rosalind
Maryborn.
Okay, what was the third one again?
Rosalind
Maryboy.
Rosalind Maryboy. Okay, just FYI, next time we're here, when I call for amendments, corrections, deletions to the agenda, this is at that time we would make those changes. But we're now running it to where we're doing a lot of point of orders that my colleagues could raise since we're adding all these names. Are there any other names that need to be corrected pertaining to our agenda at this point?
Sure.
So with that, committee members, I'd like to ask for a substitute motion to add on individuals, Rachel Holiday, Cassandra Holly, and Rosalind Maryboy to the UNHS administration. Motion made by Curtis Yanito. We have a second. Committee members for a substitute motion to add these names in. Second made by Honorable Helena Nez-Begay. Committee members, are there any questions regarding the substitute motion to add the three individuals under the Chief Medical Officer presentation? Committee members? Yes, Honorable George Poe. Okay, all right, thank you, Honorable George Toth. With that, we would also like to add on Katara Martinez under Human Resource as well. Motioning party, is that okay with you? Honorable Chris Unito, second Honorable Helena Nez-Begay. That is 4 names that will be added on under the UNHS administration presentation listing. Are there any other questions, comments? Committee members, if there is none, we do have a substitute motion and a second. So with that, I will call for a roll call vote. Honorable Dr. Andy Nez. Honorable Curtis Unito. Honorable Helena Nez-Begay. Honorable George Pope. With that, we do have 4 in favor, 1 that's unexcused absent, and Chair not voting. With that, the substitute motion carries. So with that, we will go ahead and move forward to Ms. Rachel Holiday, Ms. Cassandra Holly, and Ms. Rosalind Maryboy. The floor is yours.
Thank you, and we apologize for that. Our behavioral health director, he got sick, so unfortunately he couldn't make it. She Rachel Holiday and Chef, my dish, the Beth Bashi Chin, Canvas, the edition Mele, Subikenda Nasha, Auto. I live currently in Mount Valley, Utah, and I work here at the Montezuma Creek location. Akut ego dinas, no mission. I'll go ahead and let Rosa introduce herself.
That's a finish a collector Holly and shit. But I mean, she also about versus chain, with the treatment that should never go to the chain that should change. Where he behavioral health with a operations officer. So I've been here about maybe 4 years now.
Yeah, they finish a Roseland, Mary Boy, the Shijana. What did you the short top on her chain? Here, Annie, the Shanana, although, last year, Nasha chain. I don't know where you either though, Nasha, Madi, that's a time. A Tata or the other Aiden and Mission, a son engine. Of course, he had Rick, he not Annie, Rick Handy. I've been that, they I could not hold them. I could put a and that could only, I could put any appointment, yacht, a minute, not at home, I thought you have. I don't, I put a behavioral health therapist, I jet international, the Queen Asian, I don't, on the phone video, though, it's national, though, Zoom, though, but they did, I could put in a shot, but here.
So we represent the UNHS Behavioral Health Department. So we're going to do a brief overview of our services, and then we're going to go into our victim advocacy program.
Overview, Ninigi area, Nihi behavioral health, a euthanasia health system, be yado, Nizika, Nihido, Apo, any Nagi area has 30, another 60 staff members under behavioral health. I don't in the 90% area, not been put on Nina, Navajos and Nina. I don't in the general counseling services, a for all ages, arts, so they a children in needle, they top and after don't they. There's nothing the Nakaja Aja Eben Nishla, a the mental health has Aniki, and the case not controllation, egg is a bandage. Ado addiction, Ashi Ishigate the Hadith, Yanta and Kagi, Ado and Danish, Ado in the trauma. I had other Tishit in door veterans in the case of the Archidok and Danish, grief, and not Archidok and Danish, Lako. I had issued the Ado, when the case is this of the Ado agent large, and Nakonadish, a Archidok and Danish. Ado families are not content of Danish, Mother Jaro Chenbota. In the Taba, Mother Japid a Yakot and Danish. A quote, arts on the ultra, that's a catechator of Danish. A quote, the positions, Navakaki, a peer support specialist. AADA, Nikija, Lehotada, Kato, Ahawada had Ashi, being for what I had advanced in case had Ash Edo, the AAYA. Other case managers, AAYA, Le said ego the about the ego the Ahukashi Bichamados, they have no a case managers, but that Hagi and Danish, a cotton at Jaco, not so started in the Dago, a conda on Tata. Other school-based mental health therapists, Arjito Mahanade, A Ande Otate, Sakero Jake, Chinitan, Linigi Arden, therapists on Linigi Arden Danish, and the Hastra, A Art and Utah Strip, Jiki Arden Danish. Other therapists, Ishinashi, the Queen Asian arts when they UNHS and Danish, has Anigi and a co-art and Danish. Other adult and child psychiatrists, the psychiatrists, and any as any doctoral than any a argent that car, Ishi yat echo and dot lately hit out of Neho, Aya, Dale car, a argent Danish. Other traditional counselors, though I didn't a chipin, Tindo, I didn't a jet, Ado, Argento, the put Ashin Danish, Other in the sexual assault prevention, domestic violence, advocates like, I had Ashigin bit of Hadith. I had they are those E had Z those E had Iniki, A Ajet, Iron Danish, A positions, specialty programs, A Navajo art program, IBP, they ASFK, young youth, adult program, A art for the age group, it's from 15 to 25, a slats at the Dorona di Slats, but now I get a quite Danish. Education go Argent at the Danish. I had issued the end of it, Aggie, Edadni. I don't know got in now 365. HI 365 the wellness program. Hat ishi additional article era dago ashin the kanda honadisho hate out the initial hate ayat endo hate out the opedonisha prevention programs that haki and they are at Utah strip upon that the call pushing the house without auto tribal opioid response. As a hat ashin the yat hate out on inigi creation that the source edo nation get prevention and community outreach education. ADR bahasigi at after there is an English what Edinburgh chapter house called Ishibanda. They go up prevention program. So with Ayada had a call with Ella Hansona.
Okay, thank you, Rosalind. That's a brief overview of our services. Calandra is going to talk a little bit about some of our data that we have within our general counseling program. So the services that Rosalind and our other therapists provide, and then also our traditional counseling encounters and cases as well.
Hey, data within the behavioral health operations. We've had about 6,725 encounters this year, or is it this year?
Yes, from September
From September
21st to August 2023.
We've seen patients within just the behavioral health, 332, within encounters of 2,583. And then with psychiatry, we've had 1,178. Just within social work, 2,964. So in total, within the last year, it's about 6,725 encounters. And then with Ernest's traditional counseling, along with female traditional counseling at the shelters, we've had about 1,090 encounters in total. This is for all of Montezuma Creek and Landing, even with the shelters. So those are our data. Ceremonies, we've had about 96. We used the Hogan 164 times. We have 3 traditional Hogans. We've got one here in Montezuma. We've got one in Minot Valley, one at the shelter at the Gentle Iron Hawk. We've had visits at the nursing home. Ernest goes to see his patients there at the nursing home in Blanding at Four Corners Regional Care Center. And he visits them out there in their rooms. Office visits have had up about 134. Shelter visits, he goes and sees some of the victims at the shelter in Blanding. And he also does traditional counseling with them. He's done about 46. And then there are 458 visits that he's done. He also does at home visits. He'll see the patients at their home sites. I know he'll meet them either at the hospital in the ER, or he'll visit them in their homes at the residence. Virtually, he'll be 15 about 401 patients. So those are some of our data within behavioral health counseling with encounters alone.
Thank you, ladies. You guys can have a seat. Okay, so this is our ceremonial grounds here in Montezuma Creek. We have some pictures. And so this is also known as Ernest's office. And sometimes we have our behavioral health meetings. Every year we try to do a blessing for all of our staff. So we'll invite supervisors or department heads to come to the Hogan, and Ernest or even Wilford will do a blessing prayer or a song for us, for our employees to start the new year out. And that's Ernest there. He does, like Katira was saying, he does virtual courses online where he educates staff, but also community members. So he's there recording. And then this picture here on the right is a sweat lodge that we had built, I believe last summer, But this one is specifically for, the males. And then we have one at the shelter that's specifically for female patients and then the survivors and victims there. And I have some pictures of that as well. So I wanted to provide a brief history of our victim advocacy program. I think it gives some ideas to where we're at now and how we expanded our services. So in 2017, we hired our first part-time victim advocate through the VOCA grant, which is the Victims of Crime Act. And then in 2019, our 24/7 hotline was implemented. March 2021, the Navajo Nation actually came to UNHS and asked if we would be interested in applying for Office of Victims of Crime Act, also known as OVC, through the Tribal Victim Services Set Aside Program Grant for the Navajo Nation. So in June 2022, Navajo Nation Council passed a tribal resolution officially authorizing UNHS to apply for this OVC Tribal Set Aside Grant. So per the tribal resolution as well, UNHS received permission to have the Victim Witness Services of Northern Arizona as a sub-recipient. So that's kind of how we're able to expand our services to the Arizona side. So every time we come into a situation that is maybe at the border of Utah and Arizona, we're able to call VWS and tell them to respond. And if they're not able to respond, our victim advocates are able to do that on their behalf. And they're based out of Flagstaff, and they have victim advocates in Tuba City and Winter Rock. And in January 2022, victim services for the whole Navajo Nation began under UNHS. So like I said, UNHS, our program covers the Utah area and the New Mexico portion, whereas VWS responds to victim crime services in the Arizona portion. Today, we have a fully staffed victim advocacy program. So in New Mexico, in Gallup, we have 3 victim advocates. Crown Point, we have 2. Shiprock, we have 3. So in Shiprock, we actually partnered with the Navajo Nation Behavioral Health Department. So we're able to rent space from them. In Gallup, we are with the SAS building, which is the Southern Organization for Sexual Assault, which is located in Gallup. So we have an office there. Crown Point, it's actually out of the Criminal Investigations Department. So we have victim advocates at that location. And then here in Utah, we have 2 victim advocates here at the Montezuma Creek location. We have one Monument Valley. We have one at Monument Valley, and then we have one at Landing who's based at the shelter. So this is some of our data. We do have a data management system, which we call PMT, and our software is called CAT60. So if you're interested in more specific data and victimization types, I can share that data with you, but just for time, I wanted to just include the number of victims served. So from October 2022 to September, as of Saturday, we've served 299 victims. And then we also have 272 hotline calls. So that's people who've called our line and we answered and we provided services for them. And we also indicate that as crisis intervention. So that's some of our data. And this is an overview of our programs. So like I said, we offer 24/7 victim advocacy hotline services. We provide transportation for crime-related situations. We offer transportation for shelter, safe housing, SANE exams, forensic interviews, reporting. And if we're not able to meet patients at our clinic locations or where they're at, we're able to buy them fuel. So we're able to help them out if they need to get to a certain hospital, if they need to get to a certain family member's house for support, we're able to do that. Safe housing, so we coordinate with our shelters. Some women like to go to other locations. We also have male victims. So our shelters are only women and children. So we're able to help our male victims get safe housing either in Albuquerque or Salt Lake. We also seek services through the state crime victim reparation programs and commissions. They help cover funeral expenses, medical costs, relocation, anything related to relocation, and then they also provide funds for counseling. We do have care packages, so we provide hygiene products, clothing, diapers for women. Any of our patients who want to come in on our CPV services, we provide that to them. We work with our behavioral health department. We do referrals. We also do referrals for legal services and other victim crimes. We have funding to help our victims and survivors seek a lawyer. So we're able to help them through that process. We do provide on-scene crisis response and crisis intervention, and we provide safety planning and emotional support. We help with the protective order process. We provide support during court hearings. We also do case management. So if a lot of our victims, they lose their important documents when they're fleeing from their abuser. So we're able to help them retrieve these important documents in some other way. It's a tedious process, but we're able to help them through that. We also provide funds and resources to address missing, murdered Indigenous persons, missing, murdered, and their relatives. So we sit on Delegate Crotty's meetings that she implements, and we're able to report to her, and we collaborate with her. We're able to tell her about some of our challenges, our successes. So we directly report that to her and her team. And then the Rainbow Bridge operation. So in regards to that, we have assisted with 25 cases. And then we offered services, mostly transportation from Phoenix, bringing those victims back from those facilities. And 3 of those 25 cases have used our victim advocacy services. So we've helped them find transportation. We provided clothing for them. We give them a meal to eat. And we always make sure that they have a safe place to go. But most times they'll tell us that they have a safe place to go. And we come to find out that they're homeless. And most of them have been men. So we've been working with organizations in New Mexico, here in Utah, to find them safe housing. And these are some of our awards we've gotten. So the FBI Director's Community Leadership Award, our Tribal Liaison Victim Assistant Award. And we have our Victim Advocate Supervisor, Tanya Gratz, in here as well. Okay, shifting on to shelters. So I wanted to give a little bit of history about Northern Tree House Shelter. So in April 2018, it opened under the Navajo Nation Navajo Nation Division of Social Services. And then in February 2023, NDSS came to UNHS to propose they take over the operations and funds allocated for Northern Tree. And then in May 2023, UNHS actually took over the lease for the shelter. And just recently in June, we opened up the Northern Tree House Shelter in Shiprock under UNHS. So there's 4 bedrooms there. They offer video surveillance. Like I said, they only take women and children. We offer case management, 24/7 hour staffing. So we have 6 resident advocates that rotate through that facility. And we have an on-site therapist there. We are hiring a victim advocate that's going to be based at the shelter. And then we are going to hire a full-time therapist. The therapist currently is going back from Gentle Ironhawk to Northern Tree House Shelter. So we're wanting to be a therapist there to be full-time. And like Mike said in the beginning, we are starting new construction for a building. And here are some pictures and the layout of the building itself. So the Gentle Ironhawk Shelter, a little bit of history. In May 2021, Michael Jensen signed a lease agreement with Navajo Nation. And then in June 2021, Navajo Nation President Jonathan Nez signed an agreement to lease the facility to UNHS to administer operations of the shelter. And then in October 2021, the shelter opened. We are licensed through the Utah Department of Health and Human Services, so we do qualify for funding through the state, which we currently have. We have 8 bedrooms. They also offer a high advanced security surveillance system. We only take women and children. At this facility, we offer 24/7 staffing. So we have 6 resident advocates here as well. We have an on-site shelter manager, therapist, victim advocate, and we have a medical advocate. So we have been seeking different barriers, different challenges, and we're able to provide staff to address those things. We have a sweat lodge and a hogan on site, and we have a dog kennel. So if victims are, wanting to bring their pets, they can. which is sometimes a barrier. And we are hiring a female traditional counselor. So if you know anybody, have no apply. And then we're hiring a new resident. We're wanting to hire another resident advocate. And this is the shelter and blending. Okay, so this is some of our healing services that we provide that are culturally responsive to our victims. So we provide referrals to Ernest. We help the women set up appointments. He's able to offer ceremonies, prayers. We do have access to different medicines. So we have bitter powder, mountain smoke, corn pollen, cedar sage, and sweetgrass. And then we, as you can see in the picture, these are cradle boards that we bought from somebody locally from Monument Valley. And so we've had women who are who come in with I think the youngest we've had was a month-year-old. And so we're able to provide her with a cradle board. We have materials for beading, moccasin making, and ribbon skirt making. And we offer, like I said, an on-site women's sweat lodge. And we also do cultural presentations. So Kinalta, we talk about the solar eclipse and the significance of that, and what you can do, what you can't. So we have all those kind of cultural activities for our victims and survivors. Lastly, I wanted to go over a little bit of our funding. So this is just an overview of the different grants that we have. So at the top, you can see that we have the Gentle Iron Hut Shelter, and it's currently funded through the VOCA grant, the FIPSA MEDARC grant. So FIPSA stands for Family Violence Prevention and Services Act. And then ARP is the American Rescue Plan. So the ARP is for additional supplemental funding that was provided during COVID. So they're still offering those monies. And then we have a grant through the National Indigenous Women's Resource Center, and that is a national organization. And then we have a state grant, 5-year shelter grant through the state. We have another state grant through a contract for 5 years. So you can see the totals on the side. We also have a FIPSA ARP support for survivors of sexual assault. So through that, we've actually were able to fund a sexual assault prevention coordinator through that grant, who works with the shelter. The one that is an italicized is the Navajo Nation Domestic Violence Shelter and Support Services Grant. This was actually an RFP was opened up 2 weeks ago, and we actually turned in our proposal on Friday. And so that one is we're not yet funded by that grant, but that is $100 per bed night. And totaling about over $1 million for the Gentle Iron Hut Shelter. In regards to Northern Treehouse Shelter, we have a 5-year contract with the Navajo Nation, and that is totaled at $700,000. And then we had a donation from a trust fund, Patricia Dar Trust Fund. I believe in the middle of June. So she was able to provide a donation. So that goes directly to clients' costs. And then lastly, our victim advocacy program. We have the New Mexico CVRC program, and CVRC stands for Crime Victim Reparation Commission. And so the states have their own commissions for this. And we have one through the New Mexico state that offers, helps fund our salaries for our victim advocates and some of our services. And then we have the Navajo Nation OVC grant, the Office for Victims of Crime grant, and that's a federal grant that we applied for on behalf of the Navajo Nation. And so they significantly reduced this fund at the federal level. So we have a much smaller fund of about $946,000, whereas last year it was $3 million. So we brought this to Delegate Crotty, and we let her know that this is a significant decrease in funding, and she advocated for us. And so last month we were able to get $750,000 with the help of Delegate Crotty, and I believe through the Department of Health, for what we're calling the Navajo Nation Assistance for Victim Services Unmet Need. So that money is going to go directly to our victim advocacy program and services for our victims. And through the VOCA grant, we do fund 2 salaries for through the Utah State grant. So a little bit of our funding there. The $946,000 is not included yet. We have not been able to receive an award letter. but that is the cost that they're telling us that we're gonna receive. And here are some pictures. This is our sweat lodge that was built last summer. So we built a shed over it, so the women are able to sweat during the winter. They're able to sweat in privacy. That's what it looks like. And this is the construction of our Hogan. It just recently got completed a couple months ago. Some other pictures. And this is some of our shelter staff. We also have a cha'o there for meals, for gatherings. And then there's our dog kennel. We have a storage for victims to keep their furniture, to keep their clothing. Some of them don't want to leave all that in their homes, so they're able to bring it with them when they relocate for housing. And some pictures of our shelter, the Gentle Impact Shelter. We have a garden there. We have a playground, living room, and our contact information. Yeah.
Yeah, thank you, Ms. Holiday, Ms. Hawley, and Ms. Mary Boyd. Yeah, without so with that, that does complete the UNHS administration presentation. For those she, Chief Executive Officer, Ajit Anigi, so that they the Hasaki, Ajit and Anigi. Ado Nana the operating officer, the agent or agent Ado kill the base or to Caitlin Deco. Ado the hard be nasty joke Ado Johanna Asilico. Ado Nana Pado Miss Martinez at all. The Anita's Anje. So Johanna Anselin ko Ajit Ako and Shane the Yahoo Netselin Adonana upon the medical officer to Ado Ayokodobe has netan de Hojeta and Ahod it all hidden the ending that in car of the Ajit the cotton that was Anigi Ajit Nihajita with Anselin ko Ado Nan Nahot it. Leho, Adesan, Chinda, Naho, Leho, Dai, Adibita, Nishi, Kadoye, Ye, Aya, Janata, who is Anselin, for Ichi, Aya, Kodona, Dictate, Lady, the Yen Haho Shato, Janat, Anna, Kanigi, Kodon, Fanasis, Hanigi. Committee members, are there any questions pertaining to the presentation of the Executive Operating Financial Human Resource Behavioral Health Department and Victim Advocacy Program? Ajit Padol, the presenters PowerPoint hard copies of the case needs to lean for committee members. Are there any questions? Okay. Shinan Haniga Doko Ajidoka Nahas Ajin Yet Kasava Bishmas Hanibino Ahyan Deliki as Anje Doko Doko Asian Kodota. Iva don't screen or Ajit and the Anishi got with this ship the Ivy, which is always answering or Ella. So with that, Honorable George Pope.
Yeah, that's so snap. Johnny couldn't report that stuff. I used to work for IHS 15 years. I think this program is better than Indian Hospital. Because of what I'm saying is a lot of service not being provided. We're really strict with these funding. People turn a lot of turnovers. But we're with Gala, Fire Chief, all the way back to Crown Point. And I spent 15 years transporting a patient to other hospitals. I seen Jonah, yeah, you know, that's Nila, Oba, Mr. Muscle, a call American. Not Mary Boston. Robert Billy Whitehorse, Ocean Island. I think so, yes, it's clean. Baby, it's on that, Shinale. A call, August staff, and sending it again. Nahashni do conjuno atashti. Last stop. Asian Chindon became and Nigita, Ibata. Board was members. Again. Job in the Steve daughter. Job. A coalition was the hard of Williamson. Now Sunday store that this kid they could 8 miles an hour. There all you a car that's Nila stop. I didn't gas and oil. We have to have it 8 to urgent and that we unlink. Of course, yeah, I know it's hard, but kids and all these reports, and yet, but change over them since then. On the IHSAU, of course, all of you. Now, twin design, $8. IHSG would at all, or joy in the Naya, yeah, had in the yo. It delegation. Could you share it or either? Of course, yeah, Junior. But all in her things and they call and her know, Giam in the car, she is for out there. Of course, Kurobe had this to do. Others for the needles, ye go back to. I know, comprehend of Kadas, delegation, habitat, not only. Citizen de Villa. Citizen be a just photo, but it's a case of unless you are in the court. Yeah, don't get a lot so about not. I advocate for veterans. But you'll buy on that, ye will come at you. I don't choose. I thought I lay about some of that, no. You'll be judging was out of this time. Issue now. JD need hospital started or Washington got in the mother IHSIA critical. Basically, teach every fishing over basically which are veterans. They would a Shabbat Christianity. I wrote that on Kador Lashina, Harna Children. Diego, what's up? I those lots of notion, has no shame, lies out. He had another is another is only going in the home in the heart of the bar. It a European which had this civil yes, we saw in the page game. No need that kind of door. Against an Nina. Nina Harlan Steam, what Allah be a done at the India or doesn't keep the consider this come. But I don't know, this case in the year of that people. Once or the Koro chair that I have no other question. I'm just thankful to be here and thanks for the food. Ireya Aroya Jeshet my son. Sunday Ocho Pasha Dosha. So my Sunday or daily your job, and the day has my Sunday. Thank you.
Yeah, thank you, Honorable Cho, for those comments. For those up in, so outside, many behind the committee members, Honorable Helena Nesbitt.
Oh, yeah, so thank you for your reports, each and every one that came up and presented in your presentation. It was a good information. And this is my first time out here. You have a really nice facility here. And we need a sign way up there that says this way to the clinic. So I passed the turn off and turned around. I have a quick question for the human resource. You said that you do orientation for, you do orientation here at this building. You do it for all the clinics, so you bring them all in, and that's why you're saying that if they need motel and all that, that's how you provide food here for them to right. Oh, that's nice. That's really good. So yeah, well, thank you. And we try to be nice because you guys are all looking at me. Thank you. That's good. I mean, you guys this is just awesome. You guys are just doing an awesome job. And I was just telling my chair here, we need to hear more of this at other hair care facilities across the reservation. And a lot of great writings. And I was really proud of you guys until I heard about the last one, the Navajo Nation, 750,000, that Navajo Nation and Delegate Claudia, that Jewett Delegate Claudia for that. So I was like, yes, they didn't get anything from Navajo Nation until she mentioned that. So, but that's good. So and continue to do what you do for our people out here. Provide the best services. That's what you're doing. And even the dental services and even down to the behavioral health. We have a lot of behavioral health issues in our areas. And I wish that they could provide services like what you guys are doing, but how you present it to us. And we see Hogans built out there, but they just get all, when you look at in my area, our late President Kelsey Begay, when he was a director for behavioral health, he brought a nice facility to Kaibito and a really nice Hogan. And when you're driving by, there's just a bunch of wheat around it that just tells you that they don't utilize it. And of course, but a lot of people within, in our areas and across the reservation, they want to help, they need help. They cry for help, but they, a lot of time they're not heard, especially our veterans. So, and I saw a little bit of your veterans in here that, that's what I want to encourage you guys to do is put more with the veterans, even with housing, advocate for them and make referral to them for them, because some of them would not really speak for themselves because they were trained that way and their mind is set that way. So, and even your data, my knowledge over here, Dr. Andy Ness is always asking for data. So I know there might be see him, he's gonna ask for data. So that's what he's good at. So, and you brought some of that to our attention too. And I'm really impressed with your numbers of how many employees you have and their nationality. And, I was thinking it was gonna go down to the ages by then. So hot and Julia. So and thank you for the food. And now I know that you guys really gonna have a nice grocery store over there, because what we ate we probably find over there, right? Who was saying that they were putting up the grocery store? So one of these days I'll drive through here and check out your grocery store. All right, thank you.
Yeah, thank you, Honorable Rita Nez. Okay, with that, moving down the listing, Honorable Dr. Andy Nez.
Yeah, 谢谢Chair James Otto Adel by giving the ownership conversation which yeah Sago what so just sharing the information. It's not my first time here. I've actually drove through here. During the pandemic, they used to have open volleyball and landing, so we kind of toured this area and kept driving through. We kept escaping to entertain ourselves up there in Blanding. So Great community, great atmosphere. I was smiling throughout the recreation. I too enjoy the outdoors and did a lot of that during the course of the pandemic. So thank you. I do have a series of questions here for the presenters that we're sharing here. First and foremost, the emergency, kind of highlighting the top 3 that the community comes to our facilities for here in Utah area. I know you shared the mobile clinic data, but there was nothing specifically about what our relatives out here come into our facilities for. And one of the data here shows that, diabetes, and I think it's just across Navajo Nation, is significantly high. But the wellness centers, it's staff only, and that term only, when you're challenged with communities who you want to be able to ensure are having accessibility, not only through your virtual events or community events, but being able to possibly consider opening such a facility for them to utilize. If it's a few hours a day, great. If it's for grandma and grandpa, great. And just being able to, I wanted to question that. And also, I'm glad that there are staff who also receive their cards, sort of how they're monitoring what they're doing well, what they're not doing well. And I think that it's important in any elected position, including ours, that we're also hearing those types of concerns out there. And, there's some community members who come up to us, they'll share their insight, their feedback, and then some who use social media, unfortunately, to give their critiques. But I was just kind of curious if the board also has those types of cards. You do sit on behalf of many chapters as well as community members. So do you also, would you also consider having those cards so that you're being the best advocate on behalf of our Utah relatives up here in the northern area? Although the schools and colleges, in the presentation, it was mentioned that each of the schools have a therapist. Do each school here in our Utah relatives have access to those? And if not, then what types of services also are you pursuing when you start to address these monthly causes, such as this month, it's Suicide Awareness Month? So how do you also address some of those with our students and work more closely with our colleges as well? Also, you indicated 491 employees, most of which are Diné. However, how much of your administrative staff, your directors, your professionals at those levels who influence change on behalf of our Utah relatives here are Diné? And I'm very appreciative also of the cultural training. I think many of our visitors here to Navajo should take that as a requirement to learn more about the significance of our culture and our language. Being able to understand the purpose of hogans and sweats and what is required when they come in for these types of services, and to be understanding of those. Also, my very last question, as of right now, I was trying to go through this one to see my notes, but I'll come back for follow-up. I'm always critiquing health facilities when they just track data of male and female. It's such a false binary. As Diné beings, we cater to multiple genders. We cater to our LGBTQ+ relatives. So I always never understood why health facilities on Navajo never track that information. You have male and female, you have shelters, which we're very grateful for, that target only women and children, but we also understand some of the other needs. In order for us to be proactive and respond to the challenges that our LGBTQ+ relatives face, we should also be tracking that data and understanding that at an early age, not just 14 to 25, but prior, so that we're also being an advocate for all of our relatives. And so I just kind of wanted to question those areas And I'll go through my last sheet to see what I had notated. Yeah, should I check?
Thank you, Honorable Dr. Andinez. Are there any other questions, comments by committee members? Honorable Curtis Nito.
Yeah, non Mateo, yeah. Ron John, you know, wanted to come and have a meeting with you guys, but I don't have time, and so especially right now, we're all in person meeting. So we had to be at each meeting, not individually. I just have questions with the finance, Evans. Is he still around? Yeah, take Ben. Yeah, in finance, you know, like I just have a question with how much allocation you guys get from 638 contract and then with the Navajo Nation. As far as finance, you know, like that's what the capital and finance area and tax wise. And then the revenues that you guys are generating here from, I believe that there's some outside patient that comes in. I forgot what percentage that was, and you know, catering to the outside vendors here that I have questions on. And as far as covering the patient for the Navajo people, you know, it's always been mentioned Utah and New Mexico. I represent Utah and Arizona, so I'd like to see that the service goes into Utah as well. I mean Arizona as well. Because you guys are under 638 contract, which, you know, tells that, you know, covers all Navajo, you know, no matter what region they come from, you know, it should be served. And then on top of that, I'd like to ask questions about insurance. A lot of these patients that, you know, they call me about insurance, you know, because insurance wise, they're sent away or referred away from this facility to another to get service elsewhere. And then there's service for those kind of equipment that's available here, but I don't know why they've been sent away. And within that question, you guys get the transportation service. Yeah, the patient transports. I want to hear some indication in that area as well. And then as far as all these concern that's coming in, you know, you guys are under 638, and what is your like future goal? You know, if this 638 goes away, that'll be my next question. And then as an oversight, I see some board members on here, but you know, as far as local governments act goes, you know, I believe this is sitting on top of the ANA chapter. And I don't know if the ANA chapter is the oversight of this facilities or any organization that exists here. That would be my next question. And as far as a grocery store, I don't know if you guys are using the 638 funding that you guys have read, that the revenues that's going into that grocery store, and then you talk about Sitzla, you know, like getting 40 acres off that, and I don't know how that works, and I don't know how many of those sit in within that chapter. And on the grocery store, you know, the cost of healthy food is pretty expensive. I don't know how you guys will be justifying that. Those will be my questions, and after that, your response, I'm probably going to go ahead and cover a few areas that needs to be covered too. Yeah.
Thank you, Honorable Curtis Nito. Thank you for that. Going back to Honorable Dr. Andinez.
Just so I get all my questions from the first one. The additional question I had was on fentanyl. I know that that's something that's affecting a lot of our communities. And so I just wanted to kind of hear the insight from the facilities here on addressing that. But no, thank you.
Again, thank you, for that again, Honorable, Honorable, Herman Daniels.
Yeah, Mr. Chair, yeah, Health Education and Human Services Committee. Under the Vice Chair, Kevin, in the honorable members of his committee, the staff, yes, thank you. The board members, board chair, vice chair, I think the members of Trinity, I don't think that on the UNHS, CEO, COO, CFO, out of staff of Trinity, a lot of information, good information. For me, it's a good thing I came this way. I'm supposed to be in Winterloch today. There's a meeting going on over there too, Law and Order Committee. I'm on that committee, Law and Order Committee. So I understand this morning. It's happy. Should have our meetings here every month. Again, thank you. Thank you for your presentation. There's a lot about good information. It's a good thing that I came this week. In your presentation, public safety was mentioned. Public safety, police officers. One of the presenter for those that UNHS victim services. Yeah, no, it's not a holiday. Yeah, so at this time, what I think it is so to have a meeting out here, with the Law and Order Committee, for that committee to get an update from UNHS. So I'm gonna request for that meeting, to my committee, so it would not take it so much as capable. I in the house and that's my colleague, Mr. Chair, he was on Law and Order Committee last term. I don't know, they representing Western Agency, they have a chief, very wishical. But this is the delegate, Charles Newton's area, like PTG, Northern Agency. Well, the end, Utah, I've got Mr. Daniels, Mr. Daniels, I don't have Mr. Yanito, probably Yanito with me. So I'll take it. Yeah, but that's I don't know if we get updates at the chapter, so I don't know that bank meetings, chapter meetings, by Mr. Jackson, I don't know if I'm get stuck. We get so easy, I say about my kids, so without the data, I'll be sharing this with my committee, so members of the have a meeting here to get an update as well, so jump on it, so I don't know, listening to the presenters. You guys are doing a wonderful job, I see, gosh, I don't know the way, Monument Valley, the way the UNHS clinic. I told John what. Last year, when was last year, the 638 celebration? As a vein, you don't have a hitting down safe, so John is what I call UNHS. Keep up the good work. I see Mr. Jensen out there with his hammer the way on top of Douglas Mesa. And also the COO, yeah, and Mr. Chuck. Thank you for doing that for helping so building a nice little shack for her. So yeah, she's staying in that shack. So I just want to say that Mr. Chair, again, I don't have any questions. This comment here, thank you.
Again, thank you, for that, committee members. Are there any other comments, questions, committee members? Ado, Nana, Ado, Hipna, Softness, and Vehicle. Thank you for that. Thank you for the presentation. I do have several questions, and I'll go ahead and start off with the first presentation. That was in regards to the primary care that was provided, that's being provided at all of the clinics here. I really want to extend my appreciation to the team that is here, that is running the facility, and then also all your staff that are making you guys look really good. So thank you for that, making the board members look good. So thank you to each and every staff that runs the facility every day. Thank you so much. And that is one of the things that we tend to forget, is that we don't really go out there and appreciate our staff that are actually doing the job every day, that are actually facing individuals with big issues, small issues. And it comes back down to them for making the facility look good. And so I appreciate for putting those teams together. I appreciate you guys' effort by providing those services to your employees of the UNHS. So thank you for that, and also making those improvements. It's really hard to find individuals, especially in a rural area, to come out and make improvements for our people. And so this is a very rural area. This is my first time being here, and it was very quite a scene to take a ride from the casino to here. And I usually just take, I don't know what route that is over here, from Bluff, Utah to go to Salt Lake. I've never been in this area, and to see these nice buildings and driving up to a beautiful facility was very emotional for me. And I was really surprised to see this out here. So job well done to each and every individuals, to the past, the current, and the future leaders of Montezuma Creek. And yeah, thank you. This is what we like to see as in most of the communities throughout the Navajo Nation, throughout the 110 chapters. And so, yeah, thank you. And you guys are expanding out more, which is with grocery stores that you guys indicated, your trail system that you guys would like to implement. And to see the data information in regards to the A1C, in regards to the diabetes, that's something that we encountered throughout the Navajo Nation. And we sit there and we listen and say, how do we control this? How do we assist our Navajo people out there? And to come this morning to hear this report from you guys is very great to hear, that you guys have gone down as a community regarding your diabetes, your A1C counts, and so forth. So thank you for taking that effort and time and being away from home as being the CEO. You're probably away from a lot of family, and you're probably away from majority of where you grew up, being here, helping our Navajo people. Thank you, and it's hard to find individuals like that. I say this because I'm from the community of Ganado, and we've been going up and down, trying to make these kinds of improvement, because Ganado is a centralized location with many communities surrounded around Ganado. And so thank you, and I really do look forward to hearing more information in regards to your new Navajo Mountain Clinic. I think that is really needed. We did go out to Honorable Herman Daniels area at one point when I served on the 25th Navajo Nation Council. So I know that Navajo Mountain needs that new facility as well. And so that's one of your guys' goals and accomplishments to achieve And I wish you the best of luck, and one day I'd like to be part of it, to see it going up and then for it to be in operation as well. And then moving on to law enforcement, I know on the 25th Navajo Nation Council, I did serve on the Law and Order Committee. And that has been the goal, as how do we reach out to Anna, Utah? How do we reach out to Montezuma Creek? That has been the initial goal of the Law and Order Committee. And I'm glad that my brother, Honorable Herman Daniel, is here to hear that, you know, you guys are crying for assistance out here. The community is crying for assistance out here with law enforcement. And so we heard that through the 24th Navajo Nation Council, and I'm glad to hear him make that request, that to have a law and order committee meeting out here, and that's very beneficial as well. And I hope you guys take on his request to bring out law and order committee to host them and have them provide their information, and you provide your information to the law and order committee as well. So thank you for that. Moving on to the next presentation, the financial update in regards to the revenue. Again, it is good to see this graph. Again, my colleague here, Honorable Curtis Unito, has brought up some great points in regards by separations of how you are generating these revenues. How are you making these revenues into the millions? And I know I did hear you talk briefly of this different the documents that you forward and how you guys are reimbursed from IHS, and how, what did you say, 33% of it was coming back from IHS, or was that part of the profit millions that you indicated in your PowerPoint slide? And so that is very great to see this graph here of how the improvement is happening in revenues and millions of dollars. And as an oversight, as the Health Education Human Service Committee, the acronym, yes, we indicate it as HESI, but the proper way of saying it is most likely the Health Education Human Service Committee. And as we are the oversight of the Navajo Nation, I also like to make that known of how many years do you guys have the reauthorization in place with IHS. Do we step in as an oversight of how of the Navajo Nation? How many years do you have left in regards to the reauthorization contract that was established, that was created? And so that's my question in regards to the revenue and the profit. And if we need to go into executive session, I'd like to also make that request to you if need to make it known to you that we're willing to go into executive session to hear the actual dollar amounts, the actual numbers of how you guys are creating these information. And creating these revenues and profits. And going to your other slide in regards to improvement initiatives, I know you did talk about broadband, and so I was wondering how you guys are working with the Arcadian that's coming through here is the way I understand to get to Colorado. From Phoenix to Denver, Colorado, that Arcadian fiber optical. How are you guys working with that company to accommodate the needs that you guys are addressing for your broadband and for the community or for your service here? Moving on to the next presentation, which is in regards to Human Resource Department. I also first, before I move on, I'd like to send my condolences to the Chief Human Resource Officer. So as on behalf of the Health Education Human Service Committee, please do send that message to Mr. Herb Todd Jr., that we do send our prayers to him in this time of need and losing his mom. And so I'd like for you guys to take that message back on to him for me as well, Ms. Martinez. So with that, moving on into the human resource, what is your rate pay? What is your pay scale here for your operation? Do you offer bonus payments for your employees? And how much of that bonus payment, what is the range of that bonus payment? How often do you pay bonus payments to your employees throughout each year? My next one is professional development. Do you guys provide professional development services for your employees, your staff? Or moving on to even better, which is the educational development. Do you guys have a plan to move forward with a cohort program for employees in the medical field? Do you guys provide that service as a human resource here? Other than that, I really do enjoy all the benefits that you talked about, and I thought Navajo Nation had the best benefits, but I think you guys outdid Navajo Nation employee benefits when you guys got to the weight loss programs and diabetes and hypertension programs. We don't have that under the Navajo Nation. So I was like, wow, that's something cool, because I'm on that road as well, slowly losing weight. And usually my leaders say, you know, when you go into a council delegate position, you get so huge. And so I'm going the opposite way, and that's what I'm trying to prove to my constituents and say, hey, I'm not in there just for the food and whatnot or the drinks, but hey, you know, I'm doing this better for you guys, to tell you that we need individuals like this that should not go in there just for personal reasons. And so that's the reason why I've been working on myself. I was a little heavier when I started with council, but I lost quite a bit of weight since I started with council. It's not that the departments or my constituents are driving me crazy. It's just something that I've been working on. So I even tried telling Honorable Helena Nesbitt, let's go bike riding in Washington, DC, and she wouldn't join me. So we tried to narrow it down to a scooter. She didn't want to do the scooter as well. So so thank you for that presentation. Lastly, the last presentation regarding the Behavioral Health Department and Victim Advocacy Program. I'm very honored to hear this information that you guys are providing, staff. I can have Ms. Holiday, Ms. Holly, Ms. Maryboy, and then with also the rest of your team members. I can have for doing that service. And to me, it's always a blessing to hear a facility moving on, doing their best on teaching the cultures of the ceremonies of the Navajo, the Ne, Nahokati, and the Ne. She'eba Hinson, Nahaba Hinson, Yego, we're losing it. A lot of people tell me and say to me, we're not losing it. We are losing it. Yego, Ega, the Ne, Nahas Twin, Hizani, Natin, Nahaga, the dog, Aklashi, Adat, Yitahas Krit, Ashini, Hidde, Dobin, Adit, Kidova. We lost a lot of knowledge, a lot of songs that our elders have moved on back into the spirit world with. We don't have the whole aspects of the whole ceremonies. I'll put the handshake or the handsizzle. Sometimes we go into arguments because of the ceremony, how it's done, how it should be done. Oh no, on the East Mountain, on this side, New Mexico, we do it this way. Arizona, we do it this way. Utah, we do it this way. So, in Utah region, it's probably like that. you guys probably have a certain way of doing certain ceremonies. Little things are tweaked here and there. And it's hard, sometimes, and the reason why I say is because my grandpa, Manana Hastini, Navy James Senior, was a medicine man. Haashindo K Hati Khida, Haashindo K Aya A Nahaga, the Nia A Hot Viva Dosi Tao Viva Nohani, Lokata India. So thank you to you and your team to doing your best to keep that growing. Nata be ina nata haga zeta o hayu in regards to trying to move forward with providing those ceremonials. I know we at one point we did have 12 different Hojanwaja ceremonies, blessing way ceremonies. They are 480. Pretty soon there'll probably only be 3 different blessing ceremonies that's left. So we did lose a lot of different blessing way ceremonies, how it's done. Regarding victims. I know that's hard. I know that's hard to deal with, especially if you have a gentleman or a female coming, running to you, asking for help, especially if they're being a victim of family members, especially if it's a young one that they're victim of. It's really hard to deal with. It's really hard to comprehend and say, how can I move forward with this situation? Certain ones stay with you for a very long time, some of them probably for the rest of your life. As being an educator, as coming from the classroom, I still remember some of my students that were victims. And so I carry that on, even though it's in the back of my head, even though I've gone out of the educational field, I still remember them. I still wonder how they're doing them. And it gets very emotional when you see them out there on the street. And you just say, well, you know, I did my part. I can't be beside the person for the rest of their life. You sometimes have to shed tears, or they come up walking to you and they recognize you. Hey, Mr. James, you have some change. Mr. James, can you give me a ride? And it's very emotional about that. And so I know that's what you guys go through as being the victim advocacy and working in that field. So thank you very much for doing that and for providing those services. And then as it has the herbology in regards to different herbology, medicines. For me, I try to emphasize, don't go to the flea market. Don't purchase your herbs, your medicine from the flea market. If it's a purpose, then you go to the herb and make that offering for that individual. And then from there, you would use and collect those herbs out of label flea market or in the home. That's what I tell my immediate family. It is seen that the Nia out of the home jahan on here that those are all the different stories that correspond within the different ceremonies. You guys bypass all of the male brush and the female brush. Stop, slow down and collect the female brush, collect the male brush. And then in regards to the different hogans and the sweat lodges, if you have carrying that on, put out a street or little Ecuador Health Education Human Service Committee นี่และนี่ที่คนนั้นอ้อเองแต่เด็กที่โตเลยแล้วก็เอชีเป็นนักจะชี้เอควาดอร์นัดอ้อนี่จะคนนั้นสี่ตัวเลยแล้วก็ so with that there were several comments and questions from the Health Education Human Service Committee members and then from one of our colleagues Honorable Herman Daniels and I will just go back down the listing to respond to each of the committee members, to each of the council delegates. So we'll go ahead and start with Mr. Jensen. I'll give you the floor back and then we'll move down to Mr. Clark, Mr. Evans, Ms. Martinez, and then also Ms. Holiday, Ms. Holly, and then Ms. Maryboy. We'll just go down the list and to make those response to all of the delegates. If you guys were asked a question or a comment pertaining to your area. Mr. Jensen?
Thank you. And thank you for the compliments and the questions. We want to make this as meaningful for you as we can, so we'd like to address any questions or concerns. And if I skip something, please do let me know. On the data, Dr. Nance, we would love to be able to, if anybody from the HES committee has any data requests, literally anytime. When I showed that slide on the data warehouse, we can get it to you almost in real time. And so if you say, show me the number of patients that have diabetes, they're on a certain medication that now show improvement, we can get that right to you. So really anything you want. I just give that as a open invitation. I'll provide you my email address and we'd love to share our data with you, okay? I will let the financial discussion items for our CFO, if that's okay. But what I would say is, like on the grocery store, we are not using any 638 money. It's only third-party resources that we have earned through seeing patients in care. For example, private insurance, Medicaid, Medicare. We keep those pools of money very, very separate. I just want to make you aware of that. On the referrals, Delegate Yanito brings up an important point. Sometimes some of the rules within PRC have been kind of rigid, where if anybody can come to our clinics anytime for care, that's not a problem. And if they're Native American, there's no cost while they're here. But when it's a referred service, it has been kind of cumbersome. We have improved that a little bit. We met with our medical staff. I want to tell you what. Thank you. For purchase referred care, it's the monies we get to refer our patients for specialty care. But we did make some changes this last year I do want to share with you. So in the past, if a Native American patient from outside our service area, let's say they're further down in Arizona or New Mexico or something, came to our clinic for screening mammograms, podiatry, ultrasound, for a colonoscopy, chiropractic, and overnight oximetry. Basically, the rules said we can't see those. We have to send them back to their home of record. That's kind of how it's been. We made a conscious decision here that, we would like to be able to treat those patients. These are services we offer here anyway. And so in the last 6 months, those items we provide at our own cost, even if they're out of area. And so essentially they don't fall within those PRC rules. And for the colonoscopies, really what I'm referring to is what they call a Cologuard test. It's one that they take a sample, it's milled off, and it has a high efficacy for colon cancer screening. And so we do those now, even if they're out of our service area. But those rules still do apply for some other things, and it is a challenge. It's not great for healthcare, and that's just kind of how all the facilities do it on Navajo. On bonus payments, I would just address that, we don't do any type of performance bonus payments, anything like that, where based upon this.
I would recommend that in the executive session. Because that's the decision of our board. We discuss any bonuses. Good.
On behalf of TES, if I may, our advisor, I think you can help address the other questions first, and if the chair returns, you can make that request. Okay, thank you.
There was a mention of sustainability, you know, if we lost a key funding source, how would we sustain ourselves? I do think this is one of the real ways that our board has been very visionary. To really try to reach out and not be any dependent on any one funding source or program. So we are an FQHC, a federally qualified health center. We are a 638 for our Native American patients. We bill third-party insurances. And as our CFO mentioned, we're really trying to expand our grant writing program. We don't want to be too dependent on any program. Rather, we feel like being very broad and diverse allows us to offer a lot more programs and services to our patients. Did I miss any questions from you all?
I don't think so. Maybe you mentioned that inpatient service money. Because of the referral, all the inpatient money. You should drop.
Okay. Okay. So one of the things we, that is a challenge for us is if we have patients who do need to be referred out for higher levels of care, meaning like inpatient care, if we need to fly them up to the University of Utah or put them overnight at Blue Mountain Hospital, we are not provided a lot of inpatient money. That money does reside primarily at the service area of Shiprock. Now, we do well financially, you saw that, but we are trying to find ways to offer more and greater care to our patients. Down the road, if there were a way to get some funding for like Blue Mountain Hospital so that local patients could stay in their communities when they need higher levels of care, we think that'd be wonderful for patient care in the future. And that's something we would like to try to work on.
Does that complete your response?
It does, unless you have other questions for me. Thank you.
Thank you. With that, moving on back down the listing, Mr. Clark.
Okay, I'll try to answer as much as I can from my list. And one of the questions was about the location of our patients. On the screen there's one of the maps. There's from reporting out of Tableau, I only shared a small fraction of the data we have. And like Mike mentioned, we could quickly and easily create reports from all of our EMR and other systems. But this one kind of gives a breakdown of where the patients are coming from. And so for something like PRC, where it's based on a federal statute of geographically where the patient resides, it's helpful to know the locations of where people are coming from. And it's really interesting because you have so many coming up from New Mexico and Arizona who would have facilities in their area, but are going past theirs to ours. And that's great, especially at the primary care stage. So anything we offer in-house, cough, cold, anything fairly straightforward in the primary care sense, we can give them for free. And any tribal member of any tribe, actually. Where it gets complicated, like Mike mentioned, is when there's a referred service or purchase referred care. And that's a federal statute system. And all tribal members are kind of relegated to a system that's been created a long time ago. So it gets tricky, but we try to expand our in-house services as much as we can so that it's not all specialty. So that's over the course of the terms, that's going to be probably a recurring concern by a lot of community members. Education is really important to understanding. As soon as referrals triggered, then the IHS system, which we participate in, requires us to look at the home of record area. So yeah, all your health facilities will probably run into that. That's just a lot of information. The next question was, we took a sampling of departments today. We just kind of guessed. So we didn't present everything that we're doing. And EMS was one area that was requested a bit of a report on. I just so happened to have one that EMS gave to our board not too long ago. I'll just, in the interest of time, I'll click through it really quick. 17 EMTs, 10 advanced EMTs, 2 paramedics. That's increased now to, I think, 4 paramedics. We have an agreement with the University of Utah to provide free paramedic training. So once they've reached EMT advanced, you can get trained through the University of Utah program, and several of our EMTs have taken advantage of that. We follow the Utah EMS guidelines for accreditation. We don't have a helicopter. I noticed that picture there. That would be nice one day, maybe. But we have a fleet of ambulances, 6 ambulances, rescue vehicles. So in between, we have a side-by-side for, there's a lot of outdoor events. We provided support for marathons and those long distance races. Trucks for fast response, vans, etc. For this area, we've reached the point where we are the primary dispatcher responder for the Utah portion. This started back in 2013. It used to be a county operated system with the mutual assist agreements for the residence area and surrounding areas. Those are still in place, but the county handed off primary response to NHS in about 2013 and grown the system from there. The mutual assist agreements are important. So all of our bordering areas, for instance, Kayenta, Red Mesa, Shiprock, and Cortez, there's mutual assist agreements in place for mass casualty incidents. And also if we are caught by birds, we're there on their birds. So, yeah.
So, something else to get me. I just want to ask a question in regards to transporting patients. When I used to work with IHS in Crown Point in Gallup, the driver used to have just a vehicle operator. But later they changed their mind to where IHS requires a driver supposed to be certified as, you know, a nurse, or even we have 2 personnel in the back transporting patient. Used to be a nurse or nurse aide. How is your system work? Does EMT does all the transport to other hospitals?
Yeah, so we've followed the Utah rules on staffing ambulances, and they require 2 EMTs, either at least one has to be advanced. So at all times, there's going to be 2 EMTs. The manager there, his name is Otis Oldman. Maybe this group is going to come every year, so next time I'll probably help him do a really in-depth presentation, and you can go more into the rules and the training on that. But drivers, there's supposed to be, I think, EMT basic, and then in the back you have to have either at least one advanced plus basic, but you can have a paramedic too instead of an advanced. So Because, I just done with it. So you contract with, ambulance services, they all come out with contract, which is an hour. So what they did is they house, they gave them a house there. People that transport.
So no more of, a person with the vehicle operated with IHS. They've done away with it. We used to have a vehicle operator that stays in ER and transport these patients. So IHS done away with that. They told us to, you gotta be certified, events and also a nurse or a nurse aide in the back to transport patients. So right now, Crown Point's doing this, with Gallup Ambulance Service is transport these patients out.
Yeah, ours is, like a lot of things we do a little bit different and started ours from scratch. So we weren't having that part of the IHS system. And, so we started ours under the San Juan County and had to go over with some equipment. And so we followed the Utah side of things, the audited by state of Utah. And it is a little bit different. A lot of the facilities, they won't have their own ambulance system. They're contracted or it's through Napa EMS. It is a little different. And like I said, I think that's an interesting topic, and I'm not, an expert on that. So we'll probably have Otis Oldham present next year on that. Really good. You created this presentation, so I'm stepping out of turn a little bit, out of my area. But so some of the skills he has, our supplies, we try to supply them well. A lot of the staff are dual employment, so they'll work ambulance as well as normal jobs in other departments. We're starting to transition that to full-time only. Their claim to fame this year is they were presented with an award for the EMS World Volunteer Program. They were invited to Florida for that presentation. So they're very proud of that and sent the crew down there to receive that award. So that's the EMS. If you have questions, we'll do a more thorough presentation next time. One of the questions was about the reauthorization. In September of 2019, we received our reauthorization for 20 years. So that would be 2039 is the next reauthorization.
25 years.
25 years. But most of us are retired by then.
And that's with Navajo Nation. Now, I say, they just oversee us. If there's anything out of the ordinary, that's when they can come in based on the audit that we provide every year. They can come in and say yes or no based on the performance. They look like there's no expiration date and nothing else. 38.
And on the IHS funding side, you renegotiate your contract with them every, and you can explain more, but it's every 3 years. 5 years, yes, we're 1 year in. And you have to negotiate directly with IHS. The process, you go over all your finances, that's done directly with the IHS system. And I'll let Andy speak more to that portion. The other question was two more for HR, it looks like. The grocery store, Sitla land is held in trust by the state of Utah. So when you purchase it, it becomes private. This building was built on what was previously Sitla land. And so it becomes private once you purchase it. So we're looking to see if there's any other sections of Sitla land that you can purchase for other improvements. And then For the veterans report, I don't have a report on hand for the veterans, but we do have staff that are in charge of veterans programs, and particularly the healthcare programs, so they work hard to connect them with services out of Grand Junction as our primary veterans benefits and health support out of Grand Junction. So, we can also have a report the next time you come on that program, a good report. And then we work hard to donate to various veterans groups. We recently supplied and equipped 2 color guards with all the equipment they needed for parades, Cleveland, and the Sugar Rock area, and gave them all the regalia that they needed. And we try to participate in other ways to donate to them. And yes, Navajo Mountain was mentioned. That's our next area that we want to improve. Over the years, we've added on to it and renovated it a few times. But from the time we build a fresh new clinic there, as far as equipment goes, we try to make sure that they're staffed almost on par with what the other clinics have. So digital X-ray, they also have digital X-ray. When we purchase lab equipment, piccolo machines, we purchase all the sites at once. We try not to do the leftovers at a time amount, but technologically and as far as services go, we try to keep them on par with the other clinics, so that equipment wise, it's going to be really close. The new facility that we want to build will be really nice, like these also. I think that's all for my list of HR and finance. Do we have others? Do you have any other questions for me?
Okay, thank you, Mr. Clark, for the response. And that does complete your response, correct? Okay, with that, moving on to Mr. Evans. I believe they are going to serve lunch, serve us lunch, so we'll go ahead and move in that fashion. In lunch. Mr. Evans. After that, we'll move on to Ms. Martinez. And then after that to Ms. Holiday, Ms. Hall, and Ms. Mary Boyd.
All right, well, thanks for those questions. Those are certainly good questions. And I hope I address them all. If not, and please let me know. One of the questions that came up was the IHS 638 contract support cost revenues. That dollar amount just varies per year, but it hovers between 13.5 to $14 million. That is about 18% of our revenue, if you want to break it down that way. As Byron mentioned, we negotiate that contract every 5 years. We're about to enter into our new 5-year contract here for fiscal year 2024 through 2028, and it's looking like it's going to be close to about $14 million there when that's settled. The question came up as well, state of Utah Medicaid transport revenues. Those are about $3.5 million a year, or about 4% of our revenue. And that's part of that contract, 20% revenue that was presented as well. We are up for renegotiation with the state of Utah here shortly. We're supposed to have done that in August, but the state asked for a delay or an extension on that. So hoping for an increase in that. It was asked about what our plan would be if the 638 status was removed, or if we lost that. Of course, as Mike mentioned, one of the reasons that we're trying to diversify, although we don't anticipate that happening, there could be a plan in place, of course, for that. But we do have several sources of funding, several different payers. We have different, grants, different contracts as well. I guess that IHS just being one of those. I think Byron touched on the patients in Arizona, but we certainly don't exclude, any patients, and it was mentioned, that we see patients in Utah, New Mexico, that might be the focus. I think a big portion of our patients in Monument Valley actually do come from, the Arizona side. Patients, all the way from, Kayenta and even further than that. We do work closely with Arizona, Access, which is their Medicaid program as well, to make sure that, we're providing, the same types of services, that we're providing to our patients that are from Utah and New Mexico as well. It was mentioned, how we would fund a grocery store. We would not be using, any 638 or IHS funds for that. The profit that I showed, on that one slide in your packet there, that is, all undesignated. All of those funds are unrestricted, meaning, we use every dollar, from IHS, from our, community health center grant, for any other grant on the purposes that they're supposed to be used for. We get an audit every year on that. We have some pretty strict internal policies as well. That's around that. Those are all spent on supporting those projects. We wouldn't be using, any IHS funds to build a grocery store. And we wouldn't plan on doing that moving forward. We would hope that would be self-sustaining, and it would be a separate entity. Still part of UNHS, but it would be set up structurally different. You asked the question, Mr. Unito, about the tax structure with that. That would be, of course, taxable. That would be a for-profit portion. As long as we can keep that below 20% of our overall total revenues, we would be able to maintain our tax exempt status, as far as that's concerned. And then, of course, all our other operations would continue to be not for profit. And then, as far as the fiber project from Phoenix to Denver, I don't know much about that, but there is a separate fiber project, right?
We tied in the state of Utah's fiber.
Yeah, it would be with the state of Utah, and they are already in the process of putting that in. There is an overall project to widen the roads here coming through the area. We've already given up some of our land here to be able to do that right away. To be able to put that fiber, it's supposed to come through here, go through ANF as well, and we'll be partnering with them. We've even, I believe, contributed to that project as well. And then health insurance, it was brought up, patients being denied services on their ability to provide health insurance or proof of insurance. I personally am not aware of that. As an FQHC, we see everybody regardless of their ability to pay. I'm wondering if maybe that came from the purchase referred side, being referred out. But as far as services here at Utah Navajo, we don't turn anybody away on their ability to pay or whether or not they have health insurance. If that is happening, of course, we would definitely want to know that and can look into that. On the PRC or purchase referred care, there are some eligibility requirements for that. And they do oftentimes ask for documents, and I think sometimes there is some confusion there with the patients, and maybe that's something that we could do better at in educating our patients with that. I think that's all the questions that you had, and as you can think of any that I might have missed.
Thank you very much for the response. With that, moving on to Martinez.
I think one of the questions were how many leadership is in it? There are 24, so we have a total of 44, leadership at UNHS, 24 are in it, 20 are non-native. I think you guys were gonna go over in the executive session, the pay ranges and the bonuses. So I'll just, wait for that in the meeting. And then, professional development for staff. We do have, like I said, a tuition reimbursement program. Our team, our leadership does work with our staff if they do want to go back to school with their schedule. Really depending on what position they hold, you know, like if it's in the nursing department where they have a set schedule, then, you know, leadership will work with them. Or if it's in an office setting where they don't have to go with, they don't work with patients, one-on-one, then they're more flexible in, working hours. And then the students, sometimes if they're going to the medical program, we partner with USU, the University of Utah, and there are several other universities that have wanted to work with us. So the students can finish their hours here. And then and because we have that relationship with them, I feel like our open position for, you know, nursing, medical providers, I feel like that has given them an opportunity to see how UNHS is, and then they in turn apply for positions. So our positions are open for a minimum of 2 weeks. So we don't, I feel like there's no issues, you know, with being open for positions and filling positions for nursing and medical providers. And the two San Juan, the school therapists that we recently hired for, they were interning over at GIS for a couple of months before they got hired there. So I thought that was really neat because our therapy position, one of them has been open for quite some time, you know, just because there's partly medical applies or, you know, is qualified. But yeah, we have a close relationship with USU and University of Utah specifically. Their residents, they'll come down and they'll meet with us, or they'll stay with us for about 2 months for their semester for the nursing program. Yeah, but we really encourage our employees if they want to go back to school, you know, we show them what they need to do, and if they didn't complete school, there's always positions open that, you know, if they're qualified for, if that meets their interest, we encourage them to apply, or, you know, because we're growing and we're getting close to we're close to 500, so, you know, positions are opening up that like the grocery store, where, you know, employees who have degrees and are in that position, we really do consider our applicants who are currently. I hope that answered your question. Oh, and also the wellness center open up to the public. I know Anne has been looking into opening up the wellness center. I don't know what's the update on that, but I know that they were in, that was one of their goals. And as far as the evaluation process, we do yearly evaluation. So right now we're ending our fiscal year. And so we're, all of our employees and their supervisors are currently getting those evaluation completed. That answers all your questions.
Thank you. How many total positions does UNHS have? How many are vacant currently? And if you have a low vacant number, how are you doing your recruiting so we can steal that from you and take it back to our areas? I'm just being transparent. Again, thank you for lunch. The stew is good, the blue mush was good, the bread was good. I think, some of my colleagues are gonna ask for a second. So FYI. Ms. Martinez?
So currently we have 13 positions open. One of them is just a open position that we've had, for EMT. And, we just, anybody who wants to volunteer, it's not truly volunteering because you do get, paid hourly, when you're on the schedule, so not truly volunteering work, but you just don't, it's just as needed basis. As I mentioned, the other positions, there are a couple of them that are grant related. They're new and they're not backfill. And then the other one, a couple of them, like 5 of them, they are backfill positions where people left. And we're trying to fill their spots. Like a new one is the female traditional counselor. If you know anybody who's a female traditional counselor, you can ask them to apply. The other one is the therapist position, like I mentioned, that it has been open for quite some time just because there's just nobody applying. And then but yeah, and we're just closing up our fiscal year right now, and so next month we're probably gonna have some more positions based off of if how our board approves those new positions, you know, those positions how if it's needed and the information. But right now we do have 13 positions. And you can go on the website to look at the position.
Okay, thank you. Committee members, there's no other questions, comments. I'd like to move forward to Ms. Holiday or Ms. Holly or Ms. Meredith.
Okay, I'll be answering on behalf of our department and our victim advocacy program. I believe a lot of the questions came from Dr. Andy Nez, so thank you for your questions. They're really valid questions that should be answered. So to address the school-paced therapist, before we collaborated with San Juan School District, we had therapists in the schools, mainly just the high schools, through our EHOP program. So we did recently just do an MOU with San Juan School District. They actually came to us requesting assistance, and they had funding from the state Board of Education, and so we were able to come up with an agreement with them. And so we do have counselors in all of our schools, and this will be just specific to high school. So we have 2 therapists that will transition out of Blanding, Monticello, Bluff, and then Monument Valley. Navajo Mountain is very small, but they do within their San Juan School District have a therapist that's available virtually, I believe. And in regards to advocacy in the schools, I know you talked about Suicide Prevention Month. I'm actually a student advocate intern. So one of the ways that we do that, I partner with our department. For example, we do lunchtime activities. So we have kids talk about ways how they practice self-care. We asked them how they were feeling today, and it was all anonymous. They were able to post it on the board. We did that with the community, and then we also asked them why they think life is beautiful. And so we actually work together as a department to try to put a positive perspective to this difficult subject of suicide. We do have Ernest and myself who kind of give that overview of in the Navajo perspective of where suicide comes from. So Ernest actually talks about that story when we do these trainings, and we do have some of our staff members who are trained in assist suicide intervention. including myself. And so we're able to talk about this. And so when we came up with a theme to address this month, we came up with Ginago Nijone, so to live is beautiful. And so when we think about all the things in life that make life beautiful, that's our culture, you know, our jewelry, our corn, and that's kind of what we emphasize, and that's what we promote throughout the community. And through our Ina Behoa program and our High 365 program, we're doing community field days. So we had one last week here in Montezuma Creek, and then we're having another one in Monument Valley. So that's kind of what we're doing, trying to address suicide prevention awareness. And what we're doing in the schools. So our department is heavily involved in the schools. We collaborate with San Juan Counseling Center at the county level. So they're able to provide funding to our tribal communities. And we also have representatives in our department who sit out the county level coalitions, ensuring that our tribal voices are heard. I think before I came, that was really not really relevant. And so I heavily advocated for them to come down to our schools, to our communities, to be with our people. And I think the number one reason they gave of not coming down there was we didn't want to seem like we're telling people what to do, you know, or it's uncomfortable sometimes. And I'm like, you have to be uncomfortable, you know, and you're not telling them what to do. If you show up to our events, if you're there with them, it shows that you support us. And sometimes you don't even have to say anything. So we had done various community, you know, just sessions to have the county coalition members hear us. And so that has been really progressive. And so we're so glad that we're able to create these partnerships. And we did do in June, we did a Pride Walk. So we did that in collaboration with our programs, and we mixed it with the color run. And so that's just one of the ways that we're trying to raise awareness for the LGBTQ plus community. We have a lot of our staff who are trauma informed. So we go through training through each of our states. So for example, in New Mexico, they have their own 40-hour victim advocacy training. And through those trainings, they provide trauma informed approaches to work with LGBTQ plus communities. And our traditional counselor, Ernest, he's always talking about it. He's always talking about how we can work with our people, how we know it's heavily stigmatized. I know this is kind of a controversial subject, but even to our sweat lodges, you know, we consider different ways of, you know, if someone identifies as a male and wants to sweat male, but is a female, how do we go about that? So those are different questions that we talked about through our working groups, and we developed sweat lodge policies, Hogan policies, where we address some of the concerns. I think you were talking about how our service is provided in that regard. And we worked with one of our providers who is Navajo. She's a physician assistant, and she actually provided us a guidance on how we would screen patients to, you know, utilize the sweat lodge. And so we're still working on that, but basically it would be a physical assessment. And then we consider age, and then if they're pregnant or not. So those are just some of the determinations in regards to sweat lodge use. And I know you did mention something about community access passes. I know that one of the ways that we do this at the shelter is that we offer wellness passes to our victims. So there is a wellness center in Blending, so we buy passes. However long they're there, they're able to use that at their discretion. And we also have a sexual assault prevention coordinator who coordinates with the schools and communities to discuss self-care. And then we also talk about healthy relationships and consent. And then we also tie that into our LGBTQ plus community as well. And there was a question about how many of our therapists who identify as Navajo. And so we have a total of 12 therapists, and we have 8 who are Navajo. And then the last question, I believe, was on fentanyl. So through our tribal opioid response grant, we're able to address that. And we do have a substance abuse counselor who works with patients who are disclosing that they are struggling with any kind of substance. We have staff who are trained in what we call Trying for Life classes. And so this is a highly standardized program that they enter into. And some of that, they're court mandated, or if a therapist would like to refer them to that program, we assist in that. We have case managers, so they work with finding them employment, whatever goals that they want to work on. But in this area, I feel like fentanyl isn't a huge challenge for us. It's alcohol and meth. And so that's kind of the two substances that we see a high uptake in this area in Monument Valley. I believe I answered all the questions. Yeah.
Yeah, thank you. For those response. With that, committee members, that does complete our UNHS administration presentation. I don't see any hands going up or any requests to speak. So with that, again, thank you very much. What I'd like to also make a note is that your next annual report, we'd like to work in the fashion of on-site and out in the field. So this is out in the field. So the next annual report, we will kindly requesting that it be on-site in Windsor. And we can just work in that collaboration going back and forth. So just wanted to let you know that. Another one is for the CEO, Mr. Jensen. When you have time, if you can email us your challenges that you run into from the Navajo Nation, challenges through the state, and then your challenges at the federal level. If you can provide us that information, that would be helpful. Randomly, as the Health Education Human Service Committee, we do go out to Hill in Washington, DC, and we do advocacies with Congress. And so if we can provide us some challenges at the federal level, that would be helpful for us to continue to advocate on your behalf. And then also at the Navajo Nation level, and then also at the state level. So if you can get that information to us as soon as possible, that would be very helpful. So that would be the last request. I know we have meetings set up with the Federal Veterans Office as well. So this goes out to the administration staff. We did have very interesting conversations regarding veterans in Washington, DC. And so once we get some clarification and some information at our next meeting, we might be calling all the health facilities on the Navajo Nation to join through a virtual call regarding our veterans, on how our veterans are getting services at the local level with any of the health facilities throughout the Navajo Nation. But just wanted to let you know on that as well. So this last information, those are the three last information. With that, we will go ahead and continue on our agenda. We are still on item number 5, receiving report A. And so we will move on to the UNHS, Utah Navajo Health System Board of Directors. And we'll just go down the line. And with that, Mr. Wilfred Jones, Chair, Red Mesa Chapter.
Oyate na kita sanigi kan ons de steden dan gaan gaan we dat het niet aan de zonde en afta het dan het dan niet koke tot de zanda afta dat dat niet zo is wat aber hele ho ke die or at ja kan aan de wat de je go in niet zo to شيء يعني يكون شيء أجي شو إيه بدنا شيء ده هذا نيجي شيء دي نأخذ لنا إن شيء ما دون نقطع في شيء دي بس هذا الشيء كي طبعا هذا نقدر شيء ما دون ده شيء كان صوت نقدر شيء نال إيه هو تأيه غير تشيء ده هس كنا نهدا عند بيزنس عشان الناس تأخذ كذا شو هو ده ده أساس تشيء ده هس كان شيء Red Mesa هذا chapter في كويكا إيه نشجي بتوجه طبعاً نشتاق كده لازم نشتي كاس هذا شو توه نيات إيه هو أخو يوبا كهلي لا نغير هوجستة خش who are we UNHS إيه هو ابن شنصاص كيسو إيه له هوجستة سكيان تاني ناشين سكيان شلون جياز نكوه نغيجت آخر سيسبوت سبكين اللي له هوجستة إيه هذا نهضة كنديس عندك أكون تسبح في يادو لسانو إيه إيه كده ناس UNDC International Development Council يجتنا إيه كويه ده هوش لو خشين زاشن إيه تسبح في يان كده ناس يوم بينا أنا ده أو ناو إيه هذا كده نها خانو إتصال أيش أسعى كوين كأجي نهضة أنزا هذا شأن كنا كذا بيو هذا أنزا هذا بنا كذا بيو وده إذا نانتزا نانا كذا شأن كيشان كاو بيشان كذا بيجاسيتنا نانا ده هذا نا إذا هذا وجهه هذا نا كنا كذا فإنه بيان أهنا هنا كذا نه إيه أصله ده كنا كانوا نحشي ده إيش مياكو كارو بينيادو كنا نتزابيش كنا نتزا فكشين نه أيون ده إسي كنشي كنا إسكان أدوش تيجي هنا أنا إيه يجسي تحدينه الزيجي بدا هوسن بدا إيه تحدينه الزيجي بدا الإنسان كنديين إيه بطلع الزيجي سلطان هاد كيو هو أنا هاد أدو ده أقول ده سلة مرمر بوي هذا كنا شيء ده راب فايمرز بس ما صارنا نظام يخيل عليه في الدين أنت كبيرنا خاطئ هاشا كان هنا ليش كده هذا إتصال هذا خلاص back 1998 كان جيشان كو هذا كان هنا نظام وهذا كده هذا صور أنت أنت زد هو شيء ده إني شو بدي نيكانو تصاب تحت يكستان خذوا بدي يأكل يانا ناتش يمكن غير travel trade بيجي شيء شنايتلي يدا board of directors no أكو هتصاب أكو أنت زد عنده وشيء ده هابشن أو يجي يكستان يجي revenue ده هتصاب أكو هذا ده يجي CEO إنه اللي جاء لو أبدا دانا سينجر وديا يفعل CEO ده شماكو عن ده رو ده أبدا هذا عنده أصله one month revenue يجي staff جندو يجي كده بشيطان بقى أنت سيد هذا بيسم staff في هذا وتجي ده إننا إشنيله Utah Navajo health system is the most successful business on the Navajo Nation. I'm proud to say that. We've never been under IHS or anything like that. This is who we are, Utah Navajo Health System. Utah Navajo Health System is a community-based healthcare. Because we never really was any other health system at all. Even we try to do the best as we can. John Shindo, Koto, IHS in that has nothing to do with health. Because now, the gut, the kishan, the kishan. Ich gebe an sich healthcare, but it didn't hit it, then it's your face. That's the model that we use quite in another whole health system. Based on it, the net. It in how much is it for Mahatsa. A crocodile, a higgy, I shall be a con. Abenteuer, men and dogs for based on the Kaichi. No, so with third-party resources, what we were talking about earlier, what Mike alluded to, as the IHS, but based on it, all the operations, it all have incarnate. I shipwrecks the house of the east. Then they quite the inpatient service money. It 24 million. A co absno, Title 5, but don't need the not 2008 or not Title 5 would be critical. I thought that inpatient service money was supposed to come with that contract, but IHS. It got political. The IHS based on only not 88 not job, you title based on this other the job of the Quabasa has been, which is has been, that's on the water, neighbor. It does the board chairs. So, of course, you know, I put out, but that's a job at the house, she can't be cut. Inpatient service money get on it, we're entitled to it as under Title 5. That they need a based on data, they charter. The patients need up therefore your load and your appointments can go down. 3-4 months, that's it. That's why they're out on that point. Annually, the fund for nothing. Don't get sick in July. I thought that was a joke when I was growing up. I don't know, I would say of a face of nothing. Oh, if I was at negative, what I was I thought on the face of we get it on every month. That's the board of directors we meet with the administration as well as we get all the reports when you reported. Although every month of budget, budget committee. Visit the Hudlong, Bernard, Skina, Arnie would get Mike Jensen, there's keep base of if baby the hundreds. And they quite the Kishan, the nanny, finish it out with your hash it out. She cabbage, she put out, get the snow, now let go yard that. The crap, I put on. A masana hashit it's not the niggy we know that's me. They were honest to this. I even not they're not on inflation, they're based about again. The Kodoga did the net that other net as another. If I also know it's another because we're able but the administration but her plow everything is chain of the night. Is it select? Is it gas on the select a Padoy Cathy? If that other quality has unqualified of play, it would error. I don't understand. The Lonegi, Utanamo health system, it's on the Zambia, therefore, just stay. I don't. So the Zamban, the John, getting given it in Anna. If it is not as we do, it will not be. Who pandemic as now, I to the one it's honest. I only don't that. Another, but it's a issue of none of it on it. It all quite over that. The Zenit gauge on the government, others of the not let the cut. We kiss and beat it, then who says that our idea is wrong? I don't think it's wrong for me to sit back and I respected you for the last 150 years. Respect me. But so as you know, with all the reports that you have, we have a lot of challenges. But no healthcare, you should need a patient we're going beyond healthcare, like I was saying. Now we're starting getting into education. But they actually want to ask that. Big signs, cartoon, the next cartoon, not the what the whole shop, Tahani, Chan, Asia, should you want to the cannabis, Hatahani, Kahage, watch it out. What the next hour, it was needed to get that. The next hour was unknown, but it yoke is hidden. The car, I sent you got to get the opportunity, put it, none it, Lenigi. Even now, I got for that, did our as no also would cut it out of it. Wherever out of it in Cutler, even nine has since I could have stopped. It or the father, it or the Hinan can add on he got hit all his out of it, the cut it. That's his bar, a young business teacher. The here, whatever I'm seeking, so it, but I have a nation. I don't know that, but then IHS money in the air on that. But is she basically in the could be nine, they should be home based on Canadina, the Baho, Jesus, upon the IHS, if you get on IHS expansion or facility management, out of it, it's getting on the list. 10, 15, 20, 25 years of that, on the other hand, quite given in quite unhealthy town, dig it out. Out of the quite hard, the nanny quite no hash is an edge, the Lacana, and very quite. Hisha, the car, she hit quite it, but in the land in the day insurance, the hot no, every hour. Chapter, other Kayan the has the other. Did on the has the state of Italy. A quadrivium car has been able of Jono Equal, other than the gun in the car, not jump, you don't put away the car, but is not his name is county that's like they were saying, close to what was it, 400 employees or was it 500 employees from 17 to Shnana, within 20 years of 500 going. So, and again, I'm really proud to say we're the largest employer in San Juan County for the Ghana. They want to on Hazatlehan. It's a net. Are you okay? The tax on the state that Nana, a Kadamza that I'll feed it. We here don't know. The not half that based on the yard. The daughter. In the other ante, somewhere but this based on the needle. They don't that machine treaty of we might get away from the treaty obligation to perception. The Hoko can be at the one not there is a little Mark Robert Piper said, a minute UK don't have mental state now. I don't want it. Pilot project of shape in the but a minute that legislation. Over there to a city of Netapito. She don't know the Winslow there. Thomas Cody, that was on now you know who Thomas Cody is. When another was shit up on this, no. But has a big pilot project. It went up the area, safe. It would other Yahad, but the Gita, Navajo Health System. Educated were already under IHS issued the Nayo Hashin Zahabasa on Navajo. This is who we are. So if it's that with now, once I thought but again, it's an other what are your challenges? Our challenges like the land withdrawal happening on a year with it, and tribal land again. The Bana could only get no, could the bad all day. There the hospitals, and they keep land in the corner of after the about Kayabasas, maybe the net class, you did shit or that. No, because you could have the Granashina, Kadeshin is I don't have that, can't shut out. I don't know, indeed, what I thought that Yanek had a kind of Kaya, but as on need of the hospital of the Nigi is not the 7 acres that on house half of the land underneath. They are the night, they are the hospitals. All of that accomplished. That's another issue. So we have a challenge in those mission concept that then withdrawal. That's one issue that we really need expansion. No. The IOP can start land withdrawal. I get about some case on the any other challenges. Can't ask about it throughout the reservation. We should deal with that. EMS Red Mesa down the home about 25 miles of call. EMS again under 638. Am I correct to say that? They don't go over the state line. It's for those chain, Arizona's got service now. Push in the Quahots. That's another issue. We are the one. Are you touch it as another? Every night on him, ones of the day, never about video. Joke ambulance said those are what $250,000 ambulance. What do we have? How much do we have? 3 of them? 4, 7. So the Kodon kitchen now. For the other job, I will couch. There keeps out the other one. She's done, she's done. The any car that is the conhibent to get up with the Navajo Health System. Quite easy, but even in that, can what that's so that quite she's actually for when you get the healthcare nationality. Although the expansion, land withdrawal, elderly care, that's on our strategic plan. The housing urban development. Where are you talking about the development, the facility? Montezuma Creek, I always thought, Montezuma Creek, you're living right in the middle of contaminated soil, water, and air because of the oil field. Why would you put a health facility right in the middle of it? Take it somewhere else, put on the side of the so that's where we're at. Red Mesa, none the Red Mesa, we understand that it's already under contract with somebody else. It's your the chair didn't have a card. We gave anything. So state line, neither. You need a whole cat. A pay with a state line because you target or neither. It's a dog cat. That's over. Then it's a big picture. As you can see in the earlier, for those another was on this PowerPoint, as you can see the different areas. Included totally a 500 patients. I care. They need a welcome anybody. We provide health service to anybody. The Lacan and the other, which was court has the lowers. Dove Creek. If, so. To. The say, where you understand that. That, who was that council delegate from Toachi that passed on? When he didn't, never know. Oh, the never know, as over of faith, but he's a father. So it got the ones of the say, on that, it gave us that, autonomy to incorporate some of the traditional services that we have. We still have. I don't, additionally, we like to take our services to Red Mesa. And then, maybe even what, 3-4 times as big as this. But 4 top, doesn't cut. We hear the 8 o'clock Monday to Thursday, although they blended the everything. Limon Hospital, a hotel, AD could you get it, and they get 24/7 yet, and you get it on it. That's the way I understand. It has not out that, and it's the board of directors out of the need without provide health service that they're. Yet that not the actually expansion of it, no. And another about the not being so. It that's for eager had it job not at the dot is as the ash shown the kitchen is job on data. I bet the job is not for eager, but I will into novice in the instruction. So yeah, the snail not out of the I don't and the inpatient service money by youth people. IHSA shipwreck on the farming contract is untouchable. Although to the city and the Flagstaff to go hospital is contract is Limon Hospital. If it was contract, even nice shit that the IHSA Yago insurance done. But with the Shana, the got insurance and I did on and now, brother, I don't see not stuff. ADG, IHS on Kabande.com. I had other contract, I thought stated acquisition, never had it opened up. Hospital stay, ADG, a quite don't ash on it, not things, how about night.com. We can't all done it, no one's at the hodges. But don't share the partish, but this. Additionally, the nether can't live about that issue. Quite nearby has see what ash in the house, what ash for no, they not at Nasa. A corner based on it, I don't that they hold out upon based on a budget by India for directors needs and if other economies were included down to the net. But for the sun, but they got in that no art and the base on it. A call, that's not healthcare. Additionally, the hidden and it are coordinating. Called a yard, there's any what of us, neither Harshat of the Squid Nando, also, but the neither cannot. I saw it, not over. I did not touch a neck, so IHS needs to understand. So is that this is our livelihood every day. Every temple, every hotel. I don't know that sit like the way she chain out that's key. Sit like that, yeah, every class they put it up for sale. School section, they show that. what are your best? So I on acronym school land from state, not in net without me. And a chapter which well, what do you got? I don't know, I don't need it. No, so I'm here question, you hasn't fish up without it, none of them get it on me. John Dale, none it on the big quiet the house, you know, what was it, 7 acres here? What was it that we bought? 12 acres. Though not about the church of Kanas, not about the house, it authentic, quite hard about it. Churches of Kanas, church again, should not, so not often. If I saw that the notion was not Jason, made on that. That's so we're trying to work with all these different churches that are already on the property. If the lease way that is actually if it's business. They are the one they pass grocery store, but another shop in another place. That Kaya Utah Trust Fund, not just the Kaya, but the care. But how they generate the state land, quite as 40 acres go. It's all on cut off state now that they did it. You had to, we're gonna have to buy it as a whole thing, 40 acres or nothing. None, you know, but that's where we're at. We're gonna sit down and talk about how much it's gonna cost and whatnot, as well as the grocery store. But Mike Jensen was alluding to that. Provider housing, but I have no argument you couldn't that out there. 24/7, that's the intent. So what's your retention? And I don't know what makes them stay here. So the whole one they get and then 3 or 4 months ago, then it's not enough. Dietitian that and one that no. Oh, kidney, so that's the normal. Even now, quite a short skin of that family. But there's something that we got no choice but to purchase that 40 acres here from the state, so we can expand more. It was other young childish. It is some of the challenges that we face every day. Like I said, let's take over Red Mesa. You can't not job. But on this, but I have buy it, but the dark half. By that, get the Shubra and the dark, so I get over that job by that knowledge, not in the hospital. So, and also, the PRC. If we get as you call. I think it's based on the book and I through our annual budget agreement with IHS, we really can justify. But no, it you have for the it's all this after support membership, and they quite on then. Well, she didn't they don't care if they don't that then what that. That's the all this quite now. I should give it that. Oh, so board members. One, we got 6 chapters.
Thank you for your presentation. In regards to Honorable George Toll, they're on here, it's not on our agenda. Yeah, they're on here, so I'm going to the next one. So that completes your presentation, right, Mr. Jones? Okay, so moving on to Ms. Darrell Williams, Vice Chair, and chapter.
Yes, good afternoon, everybody. It's good to have you all out here, honorable delegates. Shay Darrell Williams, going to share here on mission. It's in Geneva, is my chair, and Hanagat is my Nelly. Sit on the board. Been on the board for a little over a year now, almost 2 years, I believe. representing the Anna chapter community. With all the reports here, just want to be pretty short and brief here. So I just want to thank the administration for their work and their reports to you and for you coming out, and also for Honorable Daniels for offering to come out with the law and order committee. We certainly would welcome you because we do have a lot of issues related to law enforcement and issues out here. And as far as challenges and opportunities, I think some opportunities that we have that we certainly would request support from the HES committee would be some of the ARPA funds that, that there are short deadlines for some of these projects. And as the deadlines approach, if there's any risk of some of those funds being reverted back to the federal government, certainly would ask that you remember Utah Health System and the capacity that we have to manage some of these large scale projects for the community. So with that, that's all I want to say.
Okay, thank you. Moving on down the listing, Belinda Farrar. Riley, Secretary, East Nutbuck.
Yeah, so Shana, Ado Shahat, Shana, Ani Ade, Hano Craigie, Chiage, Mr. Tof, Honorable Toto, Shade, or Shade Judade, Selena, Ado, Chiage Vince, Ado Chiage Arthurus, or Shana, Herman, Chiage, Engineers, Shahat. Ado, I saw Craigie though, all of our staff and all our invited guests. So Shahat, Ado, Shea Yaha, Melinda Farley, and Shea, Ado, it's national, is it funded by Shishchin, Jose, Kachini, Dasha Chado, Shini, Dasha Nale, Ado, Red Mesa, Utah, Ade, Satinas, Ahoye, Ade, Jishike, Ado, this is last chapter, Aja, Bayama, Shwaka. So I've been a board member for over 20 years. Kodo Hahoji, Gloria Dolofert, that's a cow. Ado 638, Title 1, which the Kashin Hodot need, all the 7 chapters have to be involved, so we have to have representatives from all 7 chapters. That's how I became a member. So Title 1 division, a pilot project and hit although they saw our success and then they moved forward. And we continued on. Although 2019 after I was honored to be board chair. So we were given the 25-year reauthorization through the council. So I was proud of that. And I'm very proud of where we are today. Although as a 638, there's no limit to possibilities. Although you can do anything and everything as long as you are within your scope and also whatever else you need to do in terms of providing healthcare and community-based healthcare for the communities that we serve. So I'm honored and I'm privileged to be part of this successful organization. I'm very proud of it. Although, like with IHS, like he said, people get the buildings. I think Pianta waited over 40 years to get theirs. Winslow or Ilcon, they waited a long time. So, IHS, funding them on the through here in Montezuma Creek, in Blanding, Navajo, Monument Valley, on so that's 638. So I'm very honored to be part of that and to see it grow, to see where we are today. And I'm just really, I think our communities are blessed to have what we have. So,
Thank you. Moving on to the next board member, Larissa Jackson, Treasurer, Ojeto Chapter.
Ja, snart ani do not office in the shiki ado in the executive team do board members do not so funny She Ojet Hoja Aje board member Nishtendo Aje report na shi ado sahaleho so ada nashta ako DA can be cheating, to look at the Nabashish chain, but I doesn't chain. Hachili Dashanala, but I son and a code. I can have a codifada is see and to shit though. But I can't send do the or just to give you a taste of Donna or Judge Porter, Aja chapter meeting is me. I call one of my responsibility as a community member of Ojeto, report of Ojeto Porter. I call Donna Ojeta has anago 12 items. They conduct Nishido executive team. They Atata Tehota Nike they CCS. Ako Ebits Ado in Shkabits Ado Alena Shlata Ado COO Byron Do CFO Do CEO Mike Do Andy. Nabatish Kitla Tishan Kwe Khalid Abadishno Ayatana Ashchen a conlatin. Khayda Nashadesh Kido Hashid Anat Sada Nadish Athanson about Ebenina Ako Sunday on the Ahobit Shnita George Niki chapter meeting most of the time Sundays got that Ako do a Nasha Kushik Nida Njonago Hot Adish Nashinko Atanda Yadi Quack Asahale Dishno Bahoshna today's meeting. Ado did reports that should the roads some of that was on there. I call UFU partnership in addition staff retreat the is September 14th and Ado teddy bear clinic Njanago Landa Chine that the attendance with Bahoshnet the mobile clinic. Chiditso Nikit Hashan that what is a as a Adol Nichbenga do award and the Anish with or the never 1,000 Benga Ado they Tabin this guy Diane say young day Jada but it need she and as a go what are the Janila go Kadeta being this guy he a physician assistant other than long Ravina Talker again a Argent Nadish a code Benani da other than Lenini a Hubert Dash a Arjo I thought Nadish Ado COVID test is our session each other in the yak every 2 weeks session. The 18th on the would the kidla vishno Ado chiropractic blaming J such and such the quaggy such and such Ado Market Valley the initial Sanata Ado Ani October go which that's okay. 2023 Preceptor of the Year Award. A Ravina Talker, A Adanen Long, PA Lena Nze, Monmouth Valley, Ajia, she mentoring Law Doning Tingo. She is getting recognized for that.
Nijon Washin in the Ado a October breast cancer month. Ado COVID vaccination Kodina Oshi be on the stole. The snow appreciate Kate National. Banashna. Ako Kagi, Ako Dida, the chapter which I report on the, just to give you an example of what that is. Adoko, Dida, the na, Bizarre, what Gahigi, the na, on ink. Nijana, Ako, the Nihinesh on, Beshmata Saane, Eskena Kahada, Ako, Nihizda Chita, a conjunct Kodochinek on Nahachinin on John Hajanshi, Beth Hajo, the neck Achigada, the Aj she and Doka, Ako, a queen song, Ako Ado Bayasana, Ado, Ado Great Ada. It's a Kwajahasti. Ado Baya, Ado I guess Ado Baya be unapologetic about speaking Navajo, even in public, you know. Ado the language equity for Gahigi AIDC, we need more of that. Quite bahadis so aqua and the neck igi at Nenigi ani Hashin soko up and dating at a conde as they injured the budget Nehoti capital the deep chip the neb bazarge which I had no had asked Kate on this. Then could the hatch and hearts of the garlic a shelter. Ako AD Gishi, Bende Nishashin Janko, Antoni, Ako, the executive team, Evish Bed Husband, a bear, Kitchen that was seen. Ako, the Nalsosia has a Daha, the Bedini and secretary lay front desk with us at Dahi, Jo the ne nitle, to the ne bench, dodge a co added as a tahi, the neck achieved it, or the neck achieved or as though of it are the unisha in Jonathan. A co a quest or your bench and now so yeah. A co either. Victims Advocacy Hotline, not only report Igila, the hunting kala. The Kodanek Ajisha, the hotline. Ajish la Atrakadishinda, or Nila Nike, Ajako, Haga Aja one or other Nick Ashed, that Shichahadot, no, Ako Ajapodola, I appreciate that. John, I can't okay.
I can't have, Jonah, thank you. With that, we'll move on to the next UNHS Board of Directors, Edward Tabaha, Board Member, Red Mesa Chapter.
I shall see the on the I always spend so. Oh, I said, what they don't sign it together and I put and I asked them what yeah, they bring to learn this and now, but that was that nature. But they asked to they were on our good song. Upon the care or the actions on it. A Dutch later. Or this month, other not there. This is other than harder and the distribution not able.
about to buy it. The basic said, now on the basic and every that is. Other things you can make it come back. It's been fish up. That was good. The way they use cars, they would have needed students a call area. In a way, red makes of that you guys coming, but also start that as a system. They are the quite cage, and those are quite that the house and afterwards, on the bar, so answer the age of quite for that child of it as a citizen. The Masana has made a good years to a couple Edward Tabaha student. There's Tabaha in that balance. John's mustache that. They all that. David Chan, that Edison, and then they the way they are couple. I don't know, I told it to you. Not the hydrogen down. Those we can't be that, the other could actually be so, which they have that be. I don't know, told it to you, not couldn't have assistant. I think that Arokia Anisha Canada. At Edana Anita Toy was Chendoyaha. That's it. I can't say no answer. Even on the archer of it, and again, corner and a week day, so it's not about loss. Your area, nicht in der wurde ich gerade nach der Quota so wollte ich in Chapon ist nicht a tropa is nicht a podiko zel viaje at nicht at nicht consa that was kade in state viaje from other Maya is a bit on David other figures. A couple zel, which I that she does come on the torch. I should let they know that was the top. That or the photo what now past or state as they been that they did that or Arbeit ich kann away is much possible conscience in that Ado was nan day was cheap the whole Ado said I was Ado that from there that came was today's day for you. Now to change that in the other day in the Hada state. And they are hold just the other stone. No way to learn visitor. As a missionary, Lutheran Church, as they in the village, Holola, Asian missionary, as Ado Azra, Condescended, the deport one linen, Satan, not us, or Sonda, but none does, they are not done, they are so not as such. That is un, Saint Ben, they last where Satan, it should be, I don't know what it is, about that in the Apple, hot ocean one. It shouldn't be now, the top was it on the case and the staff, institution, and so. Continent of it, just the horse, I be by fashion, the in the business man, doesn't do. That the stand of the Spenahota, our Jesus, and heavy up. Abone anige avelsning and I some other avelsning. Even as so the kid down learn this and the handad the handad Iliana Credanson. Ilan in the handad what answer. Aron Ashios Kato was Kada Nasha. Na way toward the Ifakis.
San Juan Board School, I don't have. Aronda Shukran Boarding School. Arona Lena, just the old father. The quick and the Aronda, I the whole living around the plan and Jewish agent. Ako ita aras mabes na shabat has and they go. Donde association na with that so kids with the asing. This know that. Ako joba has the had that. Aha, the hot adore. I wonder oh one. I want other a job wins and that's the needed the one. No, they are subject to a shard at the I got what I added to the kids. Shana, Iliana, Fernando, and a young dad was they. Sata 18 added soda, but that 3D soda. On such kids. Aro is cut on this cut. Aro, my high school, and in cut out on a stop. Can't bend there, but no. I was actually in a business car. So was it 8 hours from then how long? I don't just keep up as car, I don't actually think those jobs. They were the old found the touchdown. And they when our sponsor is confident, shape the snake, and they are caught on the wall. Help her, and they price it with it. The usual price for the junior college on a quite 8 cut. Continue on this field, beyond what energy business management. Joe Bob, I did so. They quite she one other than not that. I see the company on this, no, a price of that which you start. Wellington, some sugar beet and that. And they quite decent store, what happened at the next. I don't there's a car, can't what she said, no. I don't a question, so it's because I in the spiel was no, I say, I know, because in college, they should next time. Why don't you go into nursing schools? Is a car, then by this car. Ask me, no. Ask me, ask on a door to me. It's not I would quite happy. It and then I have that on the young. I did kid of that on the young. A couple of step. The old car, the cover in Kashi, Hadini, Kash, the young. A couple of edition. Oh, la don't. And they should never carry on the starting. Is out of the industry for the thing. That down in Ayodo, that James Low in Nahodin. Upon the Ebony, Iyado. Dollar Asana High are all the Yahoo. Let's get nothing go. It's a vein day. Oh, yeah, see, that a jail, Lolito, I don't know, jail, as that or the car or the door, cheat or chance cover. And they has been taken over. I became a nurse as an LPN, nurse. I was the only male nurse in San Juan County at that time, back in 1974, 73, that's right. I was the only male nurse that graduated from college of Utah. That was back in 1973. So I even as I didn't understand, I didn't on the top. The way landed those two sons about the young, a lot of stuff at the other year. We're looking for you on it. In a handy touch on it. Nakanan the story, the corner, so suddenly. The other in Chicago consider they has a big up on simple knowledge of. They look at this. So in the Sahara, so they ate not sauce when yet. I've been on top of their testing age that. From the end, I was shown, but the yards not sauce. Anything it's just that doesn't LP and Ako pe aro distance. Kita ada November 73. Tucson about the hanyada. Aro ne kode eya de kena neki Australia chona. We kodoha asuro pa chinsa. Says Kenya. There's a Mormon church was I was sure none about a question. A question can nehos a small time. They could also lay out on a Utah now put it on the council that I had a sort of a open day. And they got that when they say that there's no messages. Of course, Khan did that. But all as a pocket niggy. That was in it, Sunday planned. On answers on other day, we watch it on the party that. Okay, that's just what I see. As a shot, as if you can't stop, not enough. We're there 17 years. Even as a just case. Deep Hawkinson and all. At the hot dog, it died on us, needed deep quail. Well, it's all deep consumption, it's all that down the restaurant, cafe, Jane's Cafe, what they are that down the honestly store or quite of stores and the. I don't say the nurse doctor physician. There were only about pushing, not daily, and that's about quarter. The colleges and the stat or dental diet or contracted out on that company. I hope as China and the Kochi day. I don't when I created Chahada. I quite feasible has in Kana that I don't know then not just on it. So it speak the chapter house for Kana. I quite can days quite came in the icon as another in its small planet. So I worked there for 17 years now. I opened on that street anyway, San Juan County, as another. So I worked in San Juan County for the past 26 years altogether as an election assistant. Upon the healthcare, then it's a very interesting business. You really don't know what you predict, how healthcare will really be like tomorrow. There may be a new technology that takes place. What I usually say is that healthcare, remember I'm sure all of you went to the airport, right? And you went through this little gadget, they show pictures, x-ray you, everything. One day somebody will invent that, and I hope it's one of your children, I hope it's one of our grandkids, invent that machine to where it can diagnose anyone. And there, at the same time, you step into the next level and get your shots right there. You're cured at home. You know, that's the dream. So it's you don't have that ways away. Yes, healthcare is an interesting business. We can't really predict what we will do. We say we want to do this tomorrow or the next week, next month, next year. But a lot of things change. A lot of things open up. It's just like I said, the small health facility that I worked for many years. I never thought that this facility will go up. But I do know deep inside that somewhere along the way that this healthcare facility will grow. I've been involved in a lot of healthcare organizations, been a member of some of the healthcare organizations in the state. When I go up to Salt Lake, people will ask me, so what's going on down there? And I usually say, what do you see? Because you don't see anything, you don't notice anything because you never go over the summit mountain, you look the other way. You only go a little ways up the hill and you look, oh, okay, there's something going on. There's a storm going around down there. The reason why I say it is that Summit, I hope you all know where Soldier Summit is. Salt Lake City, there's a big mountain, Wasatch Mountain. But when you get on top, you can almost see the four corner area. Little bits and pieces. A lot of organizations from the Salt Lake City, they see only halfway up the mountain. buried on top of the mountain, and they don't see it. The day that I was involved with the healthcare system, that's what they were looking for. Then after we start this organization back in 1990 or 91, when this organization started and became a board member since thereafter, I was dragging my feet to become a board member at that point in time, but everybody's pushing me and pulling me, and so I finally decided to become involved in it. And I was fortunate enough to be involved for the last 23 years and so forth. And looking at things as it grows, as we develop this healthcare system, we build this facility, and then I always say, as you noticed when you came in, you probably enter an elevator, right? This is the only elevator in San Juan County, in the southern part of the county. We have an elevator in this building. And we're proud of it because Navajo community built it. People that are involved in the healthcare system, as they receive cash, as they receive service, they're the one that build the service up. Yes, we planned, we took action on things, a lot of things, but we depend on our community to be more involved in our planning process and all that. So based on my drone training, becoming a nurse, I became a nurse. As an LPN, worked with my community for 17 years. I became a staff nurse. I became a school nurse. I became a community health nurse. I almost became a maternal child health nurse if I didn't want to do that. But I went around and did all those things, and I enjoy doing that. But when I left my job, I let my license just slide by. I wish it had never happened, but today I'm a retired individual. But I'm glad to be part of this organization as a board member. Also glad that I am part of this organization to receive health care for myself. I appreciate that. Because I myself went through some cancer treatment. In the last 3 years, I was diagnosed with prostate cancer. And I have overcome that. With the treatment that I got referred from this clinic by my doctor, sent me to Salt Lake to Huntsman Cancer Center, and I got treated. You know, with radiation, my father went treatment, and it took him every day, almost a couple of years, but he had other underlying cause, so he passed away. But he was like 88, 87. But here I am, going to Huntsman Cancer Treatment Center, saying, I was asking my oncology doctor and said, how long is this going to take? And he said, guess what? It's only going to last you 5 days. And I was so surprised about that 5-day treatment. And he said, we're going to get you started on Wednesday. Wednesday, Friday, Monday, Tuesday, Wednesday, and Thursday. Monday, Wednesday, and Friday. On Friday, the last day, he said, you're all done. You're all done. Now I was so happy. So I'm going back in for follow-up. On my 3rd year follow-up next month, and I was told that I may be cancer-free then. Just because of this healthcare group that's sitting here, that provides service to people, that provides healthcare to people. And I'm glad that you, as a health and human service committee, education committee, came out here to listen, to find out how well we serve. And I hope that you understood how well we serve the community with our healthcare system. Because I myself am a patient of this organization. And I receive care also. So a lot of my people went through this facility and received care. Don't have to look elsewhere, don't have to drive elsewhere. As they come here, they get their service, they get referred out. Then my colleague said, we really don't turn down from other residents from Arizona, New Mexico. Yes, we bring them in, we accept it. We eat the cost. We take into exception, so we'll take care, we'll do the best we can. Hopefully that the agents, IHS will help us out, reimburse us. I don't know if they will or not, but it's there. So, like I said, healthcare is a very interesting business, very unique business, and very challenging business. We think that we can handle it. But the next day, a couple of days later, it changes again. But like my colleague, my dad, my sister, my Che, my knowledge said that the administration brought up the information. We do what we best, we do the best we could with the skill, the knowledge, the technology that we have. We help out our community. And based on that, I want each of you as a council delegate, honorable council delegate, thank you for listening to us. Thank you for coming to our facility. We appreciate each and every one of you. The bottom line, my thought is that we all did this by our prayer that we have. On finishes sort of the double be paying cripple be cut out the ask for based that it's probation that you can don't get it in Shanghai. But I see in fact in Zin of that one and it's all town. I don't know. I don't know the Georgia I best or the so the events, you know, there's not on it, I'm just saying they already. So your copy, Anna's an interesting this is done very well, instead not what it means for. I just managed to some data. I appreciate to not I don't think also to the events and real jet for it. And as a county banation, so it is a number of county on the county style, it system. According to it, I see you can copy anything. Thank you so much.
Thank you. Okay, moving on to UNHS Board of Directors. Victoria Begay, Board Member, Blue Mountain, Danette Blandy.
Ja, Dr. Mahano Kaidi, that Shay Gloria Begay on Shadow Planning, do Emasha, Ado, a low background. Shamado, Shaja, other to the eyes. When my mom was only in her teens and my dad was in his early 20s. Hawaii, Westwater, Jim, Westwater, yeah. Otto, just a kid, Otto, used to live in Westwater on the west side of the county. I grew up there, went to school in San Juan, and I traveled, I got married, and then I traveled with my husband, college, when I got Otto A. Fachin has linked, Otto A. Not planning. Otto Chinyasha has linked on Otto. I was appointed from Anna Factor to the Little Navajo Health System, Healthcare Authority, at Northern Bayatio. The Ado, the community of Anna. They appointed me to represent Landing in Westwater, Ohio, Jata, a call. I should get rest behind that night. I should question it. No, you can't say no to your leaders when they call upon you to take this kind of responsibility to be on a board. So I said, okay, I'll be the female. So I do a board member, Cindy, with Wilbert and Ed Andrea from the Ground Zero. I really wanted to be a part of the healthcare system because as a young mother, you have a lot of responsibility to take care of your loved one. A story I always tell and my board members hear this more than, I told it more than once, is that, as a young mother, as I'm probably in my late twenties, I had three boys at the time. And, they, shiprocked that they, of what, and they needed their exams. So as a mother, every year, I bundle my kids up 4 o'clock in the morning. Drive over there, my little blue Sprint. And my oldest son was about 6. And then my next one was about 4.5. And then I had my baby, Nicole. And then I get over there on 6 o'clock. And I take my oldest one will take the younger brother in, and I take the baby in. We go into Shiprock. Then on 6:30 go. And there's already a line at the front door. And I put my babies there too. Wait. They're hungry, they need change, they need to be fed. So I put my bag there. I take an extra bag so I can save my spot in the line. Take my kids into the restroom, change them, breastfeed them, whatnot, take them back out and wait there. And then go in. And then I go get my kids' teeth clean and checked, and myself. I did that. And I said, why can't we do that here? So when that was brought to me, that they wanted to start this, take over the little clinic they had here with dental. I said, sure, I didn't want nobody to experience what I did. I didn't want the younger mothers to go through that. Because on the way back, my kids are hungry, they're crying, I'm driving. So I had to make maybe 4 stops just to calm them down, to feed them, change them, bring them home. Okay, so that was like, I wanted that for this community in San Juan County when I was called upon to take that duty as a board member off for me, for my people. And like Wilbert talked about the district, Melinda, we heard from the other board members, Ed and Daryl and Larissa. But what wasn't brought up that I want to bring up is when we started, board members, we came in at 5:30. They fed us dinner. We didn't get out of that office until 11:30. I got home at midnight. Because we needed a plan, we needed policy, we needed procedure, we needed goal. We stayed late. Same thing with budget, same thing with risk management, CQI, whatever we needed. We had meetings, we stayed late. We were dedicated, these board members dedicated themselves to this organization to be this perfect today for the community of San Juan. It's very emotional and touching right now what we put into this organization. I'm proud of it. And the progress that we made from drawing on that wall, we put picture papers and the little trailer behind the old clinic. And we put our dreams up there. We wanted everything that you see right now was on that board, and we accomplished it. We worked at it, we worked at it, we worked at it. Yeah, we tripped, we stumbled, there was hurdles. But one another, we help each other pick ourselves up for our community. To be a good leader, to be a good board member for this organization, for our grandbabies. They're going to be the one that's going to keep this place going. And right now, in this nation, it's scary what's going on in our world right now. I have 4 grandkids, 4 little nollies, and I look at them and I say, your future is going to be hard. You're going to have challenges. And I might not be able to pick them up and say, you need to go do this.
You need to be a leader, you need to work hard, start your company, whatnot, to make yourself. To make yourself to be like self-government, like be yourself, help yourself and everything. So that's, it's really hard, but right now, with this organization, our administration, I am so proud of it. Because you can call it anytime. If there's something that come up, if you need answers, if you want something, they're there. But we have 7 chapters on the youth strip. Right now, the community is looking at this organization for food delivery, chopping woods, bringing woods, building homes. And they where are their chapters? We got 75 truckloads coming to us this year. And I want our chapters to be there with chainsaw. I want them to be there with their own trucks to deliver these woods to our community. Our doctors, our staff are out there delivering food through the pandemic at 10 o'clock at night, delivering wood late at night on weekends. This organization, this community, this is my family. This organization is my family, and I want help from our chapters, our community to help themselves. We can't be holding our hands to the government for everything. We need to be self-sufficient. We need to be empowered and to do these things on our own. And anyway, that's me. But I really like this organization. I've been on this organization from the ground zero to now. The facilities we have, I'm so proud of our staff. When we dedicated the blinding one, I was talking and I said, this clinic is your home. Take care of it. Clean it. If there's garbage, clean it. If there's needs help, take care of it. This is your home. And this is this community's home. Mountain Valley, Navajo Mountain, and our leaders from councilmen from back that helped us. I really appreciate them for passing legislation, helping us, support us and everything. And I know you guys are going to do the same thing. You are good leaders. I hear you guys speak, I listen, and it's really empowering to work with you guys. Otto, I just can't say any more. Help in any way you can to benefit our community here in San Juan County. I hear a lot of times when our leaders will say we're forgotten because we're on the Utah Strip. No, we can do it with your help, working together and to solve solutions with the road, with anything that's going on in our community here in Utah. So I really appreciate that. And Ed's story about him being and getting a nurse degree. And I was thinking, as a mom, you're a nurse too. You take care of your kids, you take care of your husband, you take care of your house, you take care of your parents. And you take care of your elderly. They look at you and they say, God, but no, you want to help. You want to reach out to help your elders. You can't just walk away. I was blessed with good parents. Sonny, Celine, the Shawet, she should have known. No, geez, 2 years ago, 3 years ago, I lost my dad. 10 years, 11 years ago, I lost my mom. And my mom was wheelchair bound. I don't know how she's being a nurse, taking care of her, me and my sisters. We didn't want to put him in a nursing home. And then same thing with my dad, he passed away 3 years ago, 94, and he works for the city. He is the one that said, just on the he yeah, I was just on get no, but hey, coffee, because you look out there and you see friends, relatives that are having a hard time, and you try to be supportive and encourage them to go back to school. Don't drink no more. Aşkımda sigara, aşkımda sigara, aşkımda sigara, you know, hey, and you try to do your part in that way. And we really need that facility here to, a lot of our patients, like sleep, drugs, alcohol, and then we just ship them away, Lake Salt Lake, Lake Richfield, down to Phoenix. And in our homeland, and so Avances test, and that's one of my goals is to see that in the Utah Strip is to have a really rehabilitation center for alcohol and drug abuse patients instead of sending them out. Just look at Rainbow Bridge, and then again, these people started their own, I don't know what it is, company in Phoenix, Albuquerque, and just took patients in and stole their identity and made a lot of money. Lots in the billions. And here, if we had that for our people that need the rehabilitation, it would have paid for facility or counseling, you know, whatever they needed, billions of dollars that they took. That's the way I look at that, that Rainbow Bridge. That's all. Yes, it's not sure what on Altejo. Passing what they and his relatives that they stealing their identity. And then especially government, social, I don't know, whatever they were getting, they gave away their identity. So that's really sad to hear now, and we hear it now with this Rainbow Bridge. Hopefully we can get control of that. We really need to get control of the drug, and alcohol, and then nursing home. We really need that in our community. So those are one of the things that we really want to work at as a board member, and hopefully we can get the funding. We got grant writers on here. We have grant writers for our behavioral health, and then dental, the office that's our dental is so backed up. But we're not given the fundings for that too. And there's just a lot. I wish I could have a list. I don't have my list with me, but I mean, there's a lot of things that we can talk about and exchange and support each other on. But that's all, I guess.
Yeah, thank you for that information, Mr. Gay. And then thank you for also providing us some little history on how you guys got here as a board. Yeah, thank you. Next one is Cassandra Bledsoe. Did I say that right?
Yeah, he's not here.
Okay, so she's not here. So with that, committee members, it's a no-show. So with that, committee members, there is, do I have a motion to accept the report? Honorable George Toth, and then second by Honorable Curtis Benito. Questions, committee members? Honorable George Toth.
Yeah, Jonah, the husband. Get out with yeah, Jonah. Couldn't be okay in the chair. Or the staff. Hard that was these Washington, Sanika. I just Ishi bin Jia and the heart to Kuruka has all seen that cake of Artsentical. It is Jella of his. Yahweh, that's going to be our talking stage story when we go to Washington. Okay? We advocate for all our people. Hinge Kato from the Lord John. It had me go baby. Unable to at that decision now. Oh, unheated the land. Shadi Nico. John would argue back. If all the community have that, in their mind, we wouldn't be looking at IHS for Washington. That 888, she would, my check is out of there. Nahan did and you should have done that. Has Keiko. It is that Julia, we will appreciate it. Could have us. See, once about it, thank you.
Any other comments, questions, Honorable Curtis Unito?
I want to say thank you for each and every one of you guys for putting all this success together. As we have a future that still got to figure it out. Just from your report and everything, it seems like we still need to have a lot of work ahead of us. And darn it, go get that helicopter. Let's see it. On what's I had little. With us to the shadow these so there's they so it's in the way Cheeto first born baby, they're born innocent. That's how the culture used to say the baby's crying, there's a problem with that baby. Why is that baby crying? So they get some medicine people together and try to find a solution for the newborn. That's the way you look at health. And then as everybody grows, they go through all this problems or whatever they encounter. That's where they face all this dilemma in their lives. And so they try to correct that. It's not just our tribe, it's all throughout the United States, I guess. The last meeting that I've been to was in Maryland with Samsung. That's where I found a lot of funding that's been given out to non-natives. There's 100% that was given out to the non-natives until Obama came around and started that TTAC organization. And that's why I found out that 1% is coming to our nation. And I know that you guys are aware of that. And I'd like to see the 988 program really enhance a lot of the language that you guys pursue in interpretation. The 88 con that they are on the area because it's not that. So that's true. That hard. With I another with I begin the night. So these traditions that you guys are really hanging on to is really a positive way to go about, because a lot of times, these Western medicines are built from herbal medicine, but we don't use prayers when we treat our patient with medication. In our value, we collect herbs and we do blessing on it to make it healing. Those kind of process, I guess, that the cultural and the Western medicine, they work together. I'm really glad that we heard all of your reports, and now we can see how other institutions are ran. Hopefully that we all start working together and forming a really good one institution for the whole Navajo Nation across 110 chapters. We support every one of you, how you guys want to, get this your success to be more successful in the future. Even in, there's a lot of things that you guys wanted to say here, but go ahead and email us those things, we like to, read a lot of your comments and how you guys want to be successful in the future. And that's what we're looking for. I know that, we had a lot of questions and so forth, but, this was really entertaining, meeting here. And I'm glad that I brought all my community here. If I only came here myself, I would have been overwhelmed. So I made sure that you guys are, in a positive way in every way. And I know like each and every one of you, through education, that's the only way to go about a lot of things. And, that's the way that teaching that we were brought up. Hojonju way, that's what it's all about. And I know that, these churches that have been mentioned out there, I believe they preach the same thing too. So we're all five-finger people. That's who we are. So we all gotta work together. Each and every one of you, and pat yourself on the back and be proud of what you guys have accomplished. And that's what the Utah Navajo Health System stands for. What Ashibahn needs to know the Hill Community. And I really am surprised that, and thrilled to see a lot of accomplishment here. I want to thank each and every one of you. Potato, thank you, God.
Okay, thank you, Honorable Yanito. With that, Honorable, Helena Nesbitt.
Oh, yeah, Nana. So here, Chiche. You're the main chief over here, running this whole facility, and your heart is at a good place. You have your heart where it's supposed to be. Things starts working out your way. Your dedication, your prayers, your commitment. Yaba in aware of it, that it's able. Asin Sishichi. On the Shinabe. Yellow. On the Shabbat Shidad. Ados Shivedo. Ados Chiyaj. I didn't know that I had a yard that was a nurse over there, so I'm not worried now when I get old. Just kidding. So enjoy that, enjoy the I called the original board after. I don't quite I didn't get your clans to quite call. What and the Yale here had Shema or shut it, she did that. You brought out your feelings, your heart. That's what really, your desire, that's what leads you. If your heart's in it, you can accomplish it. With your prayers, and you have a dream and you fulfill that dream, not just for yourself, but for your communities, for the elders that saw it. You make them feel good before they left. For the futures, our children, our grandchildren, they're going to carry on what you started. And this facility is going to grow, and you're going to see it. The assisted living that you're talking about, you're going to see it. We support one another. That's what it takes, planning together. One day, but in the chapter meeting. Other people have a hit on other was on the house. We're not going to get anywhere with that. If we give each other support, that's the only way we're going to get somewhere. That we could see things happen, and we're going to succeed in whatever we're going to plan for.
شاء هوان لهذا أي هاتشنا لهذا هذا أجد هاتشين هذا في هذا إننا أجد هاتشين هو حجر شو هذا. That's just how we are. So the same teaching goes wherever you go. You know, that's just, I'm just so proud of you guys for being self-determined. And to see more things like that. That's it. So, and people are going to see it. It's like you say that a lot of people come to you. Although they don't put their nose in. Let's do what they did. You know, it's really touchy feelings. Being a mother, I know what you went through. And, you know, at the end, you know, there's always a light at the end of the tunnel. You just brought me memories. But you told that story about yourself, what you went through. You know, life is not easy, but it's only us to get going. I call that for here. Whatever God, we can share though. We can share, you know, I'm really proud of him. Although my members too, that I sit with on this council, I'm really proud of them. Because we work together, we talk with one another, and, you know, we ask questions. And we support one another. Just, I call it, 2 weeks ago, you know, when we went out to BC, you know, we kept checking on one another while we were out there. Are you okay? No. This chair, you're on here, you're on now. I learned how to get on the Uber myself and get out or whatever. And she's like, oh, and you can, so. But you know, that's just how we are. A team is a team. They support one another. And you know, that's how it is. Sometimes we disagree with one another, but you know, you talk it over and you go again. And I see that in you. And the administration here too, thank you for being here for our people. And with your knowledge, with your education, with whatever you brought here to our reservation here to help our people. Thank you. I really appreciate that. And for educating our boards here, for them to grow. They grew on you. Whatever you taught them, whatever, you know, you fulfill what their desires was. They wanted someone that they can lead on to grow on. And that's who you were. So thankful for that. I'm very thankful, and we're thankful that you're the person that you were sent here by to be a blessing to them, you know, to teach them to go. Back to you, Chair.
Yeah, thank you. Any other comments? Committee members or questions? If not, again, thank you. Thank you very much for that information. Just one real quick response to Mr. William in regards to the ARPA. I assume that you guys would have your packet ready for your request of ARPA funding. If you can forward that information to our staff as well, that would be helpful. For us to understand where you guys stand in regards to requesting for ARPA funds. We will have another ARPA meeting tomorrow in Window Rock. We just received that email. So we continue to receive updated information from those departments that receive ARPA funds. Some is a go, some cannot be a go. And so there is funding that will eventually be coming back to the pot, and when we address those funding, it's just unknown at this point. But it would be good to have a listing going on behalf of the Health, Education, Human Service Committee. And that's the reason why I'm asking if you can send over your ARPA request from your organization from here as being a part of the board. And then I guess we can get more information on the teddy bear clinic, that was also, brought up. That would, so I might come back just for the teddy bear clinic. So again, thank you very much. And yes, let's try our best, do our best to keep, the Navajo language alive. And usually for me, sometimes I have to apologize on council floor to speak in Navajo. I do send my apologies to presenters for speaking Navajo, if they're non-speaking Navajos. And so I do that, but majority of the time I do try to speak Navajo. So again, thank you. And I did receive several information, the challenges from the federal level. The way I understand it is under the Blue Mountain IHS contract. So if we can get some more information on that from your CEO, that will be helpful. I totally agree. That's how we advocate on the Hill as the Health Education Human Service Committee. We respected and honored your policies, your procedures, your guidelines for over 150 years. Now you need to listen to us as the Health Education Human Service Committee of what we're requesting to you on behalf of the Navajo Nation, on behalf of how the Treaty of 1868 was put into law for us. So with that, our last trip, this past trip, we did get to visit the original Navajo treaty again. So it was a blessing and honor to have those taken out of the vault, and then, well, actually, we went into the vault and then taken out of the drawers and so forth to see the original treaties again. So so I agree with you on that comment that you made, Mr. Jones. And then two other things that I found in your guys' presentation regarding challenges under the Navajo Nation is the land withdrawal from the Navajo Nation and the roads for EMS. And then another one under I just through all your guys' presentation, the challenge under the state level is the state boundaries, the state jurisdictions, the state line issues that you continue to run into. So those are going to be added on to our challenging listing on how we lobby ourselves at the state level and then at the federal level. And then, yes, these two that you mentioned internally, the challenge of the land withdrawal on the road is just an ongoing, continuing issue that we're trying to resolve as a 25th Navajo Nation Council. So again, thank you for that. Thank you for your presentation. Committee members, we do have a motion on the floor. Motion made by Honorable George Pope and second by Honorable Curtis Yanito. There is no other comments, questions. I will call for a vote to accept the report from Utah Navajo Health System. They provided their annual report. And so with that, no questions, no comments. I will go ahead and call for a vote. Honorable Dr. Inez. Honorable Curtis Yanito. Honorable Helena Nez de Gate. Honorable George Toth. With that, we do have 4 members in favor. 1 vice chair unexcused, and then chair not voting. With that, motion carries, and thank you again, Utah Navajo Health System, UNHS, for providing your report throughout the day. So thank you, job well done, and congratulations to you guys. And with that, moving forward on our agenda, there was a request from the Fields organization as well, for them to provide a report. It is 2:24, and so committee members, I leave this up to you. If you guys like to do a substitute motion to add the organization to the agenda, And then we can go ahead and plan with them on how we can proceed once we get to that item. Committee members, motion made by Honorable George Toth, second made by Honorable Helena Nancy Gay. So that would be the item under B as receiving report under item 5. So with that, are there any questions to add on the field organization to provide us a report? Committee members going twice. Okay, roll call vote. Honorable Dr. Andy Ness. Honorable Curtis Unito. Honorable Helena Nancy Gay. Honorable George Toth. With that, we do have 4 in favor, 1 unexcused, and chair not voting. With that, our motion does carry, our substitute motion does carry to add fields as item B under item 5 as receiving report. So with that, the floor is yours, Fields. If you can come up and provide your report. Your report, since this is an added item and your report will be, we will give you 20 minutes to provide your report. I know there was some recommendation as well to just go out to the field as well to provide this report out there. So it's up to you at this point right now. You guys are on the agenda. If you guys want to proceed with providing a report here, or if you guys want us to join you guys at the field after we adjourn from this meeting. So I'll leave it up to you guys, but you guys are on the agenda right now. So Pantela, the floor is yours.
The chi chapter the ya na sha. Aro di the squeak quagging the business don't car no school. We car di was no. Oh, di na how when the look. Ko de ya pali car to panet the Ardina the cover cars stop there. Agenda the way. NTU, the ASU, because he thinks so. I don't call in the other, they got called in the land, she just can't pass the net, they don't win the other, so, you know. Of course, you know, down the cat, although she wanted Nana, the way Labor Day, and I thought, and then he's been on the car, he didn't know this to hold it. I don't probably got to be about this at Quagging College, so she needs the Kagi, ARJ, thing for any net or this. Although Quaggy, the Quaggy is in was Anigi, Equachashin, so was caught Zenigi, instrumentation, but yeah, the way all fields of gauge that now the dog pump the calibrate that with our instrumentation already healthcare facility going to be the quarter health machine of the calibrate doesn't it? Issue machines so you have to be quite in the sheet so that's what she by out there. I don't know way down in the way gallop in the shop hotel and the shop and then grab it gone and it's on here. Other than a national over the stone with them care. That shady Allison and shuttle being the way IHS healthcare facility now, no nation. The kind of style contract should be the machines they calibrating is in here. Of course, the casualty is well. I should have a Hassan and I don't have to. بكون كنت أتشنجا أو كدويو بوسام ويتكتبا بتأو هي بفوتي وده بكو إبن السندون شيء كذبي بارن ده تو كه
Chairman and honorable delegates, committee members, we're honored to have the opportunity to speak. Thank you very much for giving us that opportunity. And really excited about what we heard here. It's very inspirational as we got a chance to listen to UNHS, what they're doing, and we're very excited about that. They actually helped us early on with our project here. And they do so many things for this community. Mr. Chairman, what we would like to do is to move over to our training center. We have a training center, one of our project sites here in Montezuma Creek at Whitehorse High School. And we think that in just a few minutes of you being able to go and experience what the kind of training that the Navajo youth are receiving here that are leading to skilled employment in industry here in the region. And, they say a picture is worth 1,000 words. And so that would be our preference. And then if you would like us to provide a more detailed report, then we can be there at the next meeting on the 9th or whatever would work for you. But that would be our preference, Mr. Chairman.
Okay. All right, so when you make that recommendation, the gentleman behind you is like this with his bolo tie, so I assume his bolo ties will be raffled off over there. Okay, committee members, we have two tours. We do have a tour here with Mr. Bryson Hart as well of this facility. And then also now here at the Whitehorse High School. So Ishi, if that is okay, if we're in consensus, committee members, are we okay with those, with the tour? Do the one here first, and then after we are done here, we can move over to Whitehorse. Honorable Dr. Andy Nance?
Same thing, I have to be excused here shortly, so
Okay.
that's why I'm just like, my tour, good. But I'll be departing back.
Okay. Honorable Curtis Unito? Okay. Honorable Helena Nazagay? Honorable George Toll? Okay, so it sounds like there's gonna be 3 of us that will be coming over. I don't know if these two are going to excuse themselves once we adjourn here. But there's 3 of us that will take part of the tour, and then your tour as well. I don't know if my brother's going to join us, Honorable Herman Daniel, so now you have 4 council delegates that will be joining the tour. So with that, we will go ahead and honor your request to take the tour and all of that over there at Whitehorse. So with that, we're good to go with that then, if you're good with that. We'll see you over there. Okay, so with that, that was a real quick receiving report. With that, moving on. Okay, so with that, I will need a motion to accept Bill's report, brief report. Do I have a motion? Honorable George Toll. Second, do I have a second to accept the report? Honorable Dr. Andy Nance. So with that, committee members, are there any questions in regards to the field report? With that, committee members, none. Roll call vote, Honorable Dr. Nance. Honorable Toll. Honorable Unito. Honorable Nazagay. With that, we have 4 in favor, 1 unexcused, and chair not voting. And so with that, motion carries. Thank you for the brief report, Bill, and we'll join you there for a field tour. With that, moving on to item number 6, old business, there is none. Item number 7, new business, there is none. Item 8, close of meeting, announcement and adjournment. Announcement is September 27th, to Wednesday, we have our New Mexico Education Secretary, remote meeting in Santa Fe, New Mexico. October 9th is our regular meeting, in Window again. So 8 a.m. So those are the meetings that we have on here, and then of course, we all have our internal, meetings as delegates each state, so. Just to let you know. Are there any other announcements, committee members? There is none. I will call for a motion for adjournment. Motion made by George Toth. Do I have a second? Honorable Curtis Ianito. Committee members, are there any questions, comments regarding adjournment at 2:35 p.m.? Any questions? Twice, 3 times. With that, roll call vote for adjournment at 2:35 p.m. Honorable Dr. Nez. Honorable Unito. Honorable Nez Begay. Honorable Toth. With that, we have 4 in favor, 1 unexcused, and chair not voting. With that, thank you very much. We are hereby adjourned at 2:35 p.m. Again, thank you very much, Utah Navajo Health System, for your hospitality and providing breakfast and lunch. Again, thank you very much.